Active?
No, I'm good, thank you.
Okay.
All right, Louisa, did you want to take a shot at your research question?
Sure.
All right. I'm going to write in green, because there's no other green.
Turn around.
My question is, will the faith-based and civic community setting help to be a setting for change of behavior in reducing childhood obesity?
All right. Setting for, I'm just a slow writer.
Faith-based and community setting be an effective change for setting for change of behavior with childhood obesity.
I mean, it's
You
just
need a stool?
Yeah, I think I do. I think that's the problem, isn't it? All right. Will faith-based and community?
Will the faith-based and community setting be an effective vehicle for change in childhood obesity? Change in behavior, sorry.
Change in behavior related to childhood obesity.
Mm-hmm. Thank you.
So will faith-based and community settings be an effective vehicle for change in behavior related to childhood obesity? At least, okay. So, remember the finer criteria?
Yes.
Okay, so we're going to talk about feasibility. Interesting.
Effective. And realistic.
Ethical.
And realistic.
Yeah, well, relative. Okay. What do you think? Feasible?
I think it is because it is utilizing the faith community. We often have a lot of events that involve food and activities. Can some of that be designed so that there'll be healthy foods available rather than some of the traditional? And can some of the, when we're at the faith-based community, can we incorporate some physical activities such as in the spring and winter, the churches have Walk to Jerusalem, Walk to Bethlehem. Can we get walking programs initiated, and maybe they would be carried over throughout the year? Can we involve our local parks and recreation to have it safe enough to go out and do some walking in our areas? Are the parks safe enough that you could go to, because some of them have been taken over? Interesting. I think it's interesting in the fact that we are trying to show the relationship between faith and health, and to get our children to buy into some of our, to buy into their sermons around health issues, that we want to enjoy life on earth as opposed to wait until we get to heaven. Novel. I don't think it's been, as I said before, I don't think this kind of project has been done in any other setting other than the school and parental involvement.
Well, let me ask.
Nationally, it has.
Okay.
I think, yeah, I mean, I don't know the literature on this, but I think you want to be really, what's the word? Meticulous, methodical about understanding who out there has done this. And especially, like, when you say community settings, that's a pretty broad term.
Mm-hmm.
So, you know what I mean?
Like YMCA, that would count as a community setting, and they have their whole own thing.
So I have a question on that. Is the target faith-based communities, or is it faith-based and community settings?
It would be.
I mean, are you focusing specifically on faith-based settings?
The focus specifically is on faith-based. However, we interface with the civic associations, not the Y, not the other places that we don't really show up at.
But it's almost like your primary node is the faith-based community.
Right.
And that would be like kind of the
Captain
The
on
glue,
it,
yeah.
Yeah, and that's, I just raised that because the way that's written, faith-based and community would make you think the one, you know, the bigger universe.
civic
So-
I'm looking at the
association.
civic and neighborhood
The
association.
neighborhood, yeah, that's what I was thinking, that was the vision I had, was that they're neighborhood-based kind of groups, which is different from the idea of community that some of these other organizations put out there, but I think,
no, that's a good distinction though.
Yeah.
Yeah.
But I would change that
Okay.
community
Where
to
people-
neighborhood based.
where people
It's
live.
really-
Yes,
Yeah,
yes.
Maybe I you know, is the question that you're asking really, will a partnership between faith-based and civic communities be an effective vehicle?
That wasn't my initial
No,
thought.
I got it wrong. Okay, then I didn't, try me again.
It was a combination because not everyone goes to a congregation, mosque, or temple. So let's find those who are involved in our neighborhoods that those faith-based organizations are established and work with them, because that's what I want, a connection between faith and health, which the civic associations would be more attuned to.
Yeah, I guess I'm still a little confused, and that's okay, because if there was an organization that was, you know, if you were looking sort of at the Venn diagram rather, you know, and you had an organization out there that really was just community, and then here you have your faith, you know, based. Are you saying that you wouldn't look at them alone? You would look at when they reach out? I'm confused.
The interface between the civic association or the neighborhood association and the faith-based, because I'm looking at the faith-based organization to be the hub of where the project will take place and that people can tie into. The civic association, we don't always go to the temple or so the civic association is more driven towards what's happening in their community. And there's establishing that component, that health committee for that civic association, so that they could drive specific health initiatives in the community based on childhood obesity.
Okay. So, would the faith-based community be reaching out to the civic association?
Yes.
Okay. So
Yes.
it's sort of you in leadership of your project. Your first step is the faith-based.
Yes.
And And then it's getting the faith-based to connect with these civic associations.
Yes.
Okay. And then you want to see if is that an effective
Vehicle for
vehicle.
driving
Okay.
the initiative.
A lot of times, isn't it the same people?
Or not?
Not
No,
necessarily.
no, because a lot of times those in the civic association don't belong to any specific.
Some overlap.
Some of them do, but I mean, it wouldn't be in that particular neighborhood, because now it used to be that we worship where we live, but now people drive distances to get to where. So we want to concentrate on that neighborhood where that church is established, because that's the main thing, is making the connection and getting the church to come outside the door and reach the community. We're not trying to proselytize or do anything like that, but we're trying to show that your health and your lifestyle choices are connected to the same thing the preachers talk about on Sunday morning.
So it's almost like, I mean, I know this word community kind of has a number of different sort of definitions, but it's almost like faith as community or faith as neighborhood, because you're wanting, there's kind of this outreach part where they're, like you said, they're going outside of their walls so that they're being a part of the larger neighborhood, and kind of the thing that they'll do would be around this obesity prevention.
You know, it's supposed to be what you're there to do in the first place. You go and hear the sermon, and then you're supposed to take what you hear outside into the community.
Yeah.
But that's not happening.
So I have a couple of questions then. Should it really be will is the word introducing your question? Because when you start with will, the answer to a will question is yes or no.
Yes or no, yeah.
And I know that seems picayune, but certainly I think what you're struggling with is if you kind of go with the one model of what you're talking about as your question, I think your question really becomes, how can creating a faith-based community connection be an effective vehicle for change in behavior related to childhood obesity? Or, I guess the other one is, it could remain will, like will creating a connection between faith-based and community settings be an effective vehicle for, and in this case you might even put in dissemination of is it heart and soul?
Body and soul.
Body and soul, for dissemination of body and soul. You know what I mean? Like you could get very specific in that direction. Do you know anybody else say it better than me, or am I not? The look on your face makes me think I really missed my.
Since this has never been tried,
Yeah.
To me the question is will, because either yes or no. That's your outcome. Mm-hmm. It's going to be either yes or no, and I don't know that.
Okay.
And that's what we want to know.
But what if you took one step back and said, even before you ask yes or no, how are we gonna even implement it? Because you've done body and soul before, but have you done it in this package before?
It has been effective in the churches that I've done it.
And with this level of outreach to the neighborhoods?
We did outreach to the neighborhoods.
So
it was just to the members of the congregation.
Oh, okay. So to me, that part would be the how question, because how is it going to work between the neighborhood? But if, like you said, if it had done before, then it is more like the yes, no.
It's been done before, and that's why I think we know that particular curriculum is effective. We know that. That's been proven.
Yeah.
So, which is why I jumped on it.
Yeah.
I guess my question is your initiative going to be trying to make this happen, or are you just looking at it to see if it happens?
No, I want to make it happen.
Okay, then,
We are going to do this.
okay, so to me, as, you know, somebody coming, if you want to do it, you want to see it, how it's going to work, and then you want to take the pieces, those process pieces that Allison was talking about, and figure out, okay, what are the things that make it work, so that then we can actually take that to another place and do it successfully, and maybe it's not you, it's somebody else because of your work. You can actually write that up, and then they can say, okay, this is how it's done.
I kind of considered that rather than doing it in a local setting here in Wilmington, to do it statewide, because we have statewide chapters and have it set up in different settings, rural, urban, suburban settings will show different. So after I bring the groups together, if there's an opportunity to take it further, another step. But my basic question is, can the faith-based community and civic associations coming together make a change in the child and parents' behavior, their choice to choose healthy food and engage in more physical activity? That's what that's what I want to say.
Yeah.
Okay.
But you know, I like kind of what Liz was getting to, that understanding what are the factors of that faith-based environment that contribute to it being successful. So you are going to do it, but one of the things that you want to learn coming out of that, you know, are what are the characteristics of that community? Is it that there's that you have a lot of volunteers who are willing to participate, that there's
and clergy buy-in,
you know, or connections to, you know, connections across domains. So you have connections into schools, and you have connections into major employers, you know, all that. Like, what are those?
Maybe the community is there a community center or a place, or can they negotiate that with the faith-based organization, you know, to have a place to do, you know, I mean, all those factors that maybe would make it successful.
Right. I mean, and knowing that then helps you think about how to replicate it. If you were going to do it someplace else, what are the characteristics you need?
The two settings was the faith-based and the civic association, which would be the neighborhood center or the PAL center or something like that, where people normally go to, so I don't have to beat the bush for that.
Nice.
So in the interest of time, we're going to have to switch over to the other team and research question. Just my 2 cents to keep in mind, as you think about your research question, ask yourself, you know, how will I know I have succeeded? You want to know effective, you know where you want to land. What is it that you would want to see to say, yes, this was effective, and to see it in a way that you could be reasonably confident that, you know, it's related to the faith-based community civic connection. Do you know what I mean?
Wouldn't that be at the end of the project, those are metrics that the center established in the project to say, yes, it was, or no, it wasn't?
Right, exactly.
Okay.
Exactly. No, I think this is, you know, I'll be curious. I mean, this is you're in the correct neighborhood here. It's just a matter of you deciding, this is my question. Do you know what I mean? Like, and, you know, making, you know, and then getting, you know, we can all help wordsmith for clarity. Okay? So, I don't know, Brian, do you want to put your research question up there for community health workers?
Sure.
By the way, I am convinced that you actually are Superman, Clark Kent, because I don't know how you walked out of the room
No,
And got back that quickly?
I didn't.
Oh, you didn't?
No, I got across the street to get my keys, and my wife called and said that she got the door open. So.
I was like, man, he's fast.
All right, Brian, you just disappointed us.
Yeah, sorry.
No, I'm not that bad. I think better than I did.
So this is sort of a three-part, right? The major question is, how do patients and families define the value of community health workers that they've interacted with? The second piece to that is, are there common values across delivery models? Because we know there's different models of delivery in which encompass community health workers. And then the last piece is, if so, can those common values be used to develop common evaluation tools used to assess community health workers more globally than the current practice, which is program by program, basically being driven by the funding mechanism downward. And what's been driving my interest in this has been the notion that sort of nationally there's been a focus on community health workers and community health work in the sense that it's a reimbursable model. These individuals are reimbursable now for the care that they provide related to both Medicaid and Medicare patients. So there's money, essentially there's money being left on the table for this type of work if it's of value. The second piece is that most of the way that we've designed, at least in Delaware, our ability to utilize community health workers has been in distinctly different models. Ones that have been more upstream community social orientation with quote unquote lay health workers and that sort of thing. And the prominent feature in Delaware has been primarily case management model driven by health systems or care providers with a disease-centric focus, right? Population health model. My hypothesis, if there is one, is that patients and families, regardless of the model, will identify value of these type of workers in similar ways. and that those common themes in terms of how patients and families identify values can maybe begin to help bridge the gap in the differences in how people define community health workers, and maybe bring us to a closer consensus on how to organize around actually being able to reimburse for these the work that these folks do over time. So that's where we're at. And the way that I propose to answer these is sort of three-tiered, as you can imagine. One, the first way is sort of a community-based participatory research approach where community health workers themselves who have agreed to participate as researchers in the project are going to be co-conducting a series of 12 focus groups across the state with folks who have self-identified or been identified by different programs as receiving care within the past 6 months, 6 months to a year, from a community health worker. That will the second question will be answered through a participatory qualitative analysis process where community health workers as well as the research team will go through I can't remember the exact name of it now, but there's a formal qualitative analysis process that's used to identify themes relative to a grounded theory approach. But regardless of that, utilizing those themes that come out of that analysis, bringing it back to patients themselves to sort of member check and assess validity, right? Can we say that what we captured is actually what they were telling us, in the first place? And then working with the program teams to come up with some potential common evaluation tools that they would agree then to implement in their programs. That's it.
I have one.
Sure.
Actually, 2 words, but one concept. Have you looked at agricultural extension?
Yeah.
And their workers, do they have a model for evaluating?
Yeah, absolutely. And they're a lot further down the path, so to speak, in the sense
they're the original ones.
Exactly, in the sense that globally they've kind of agreed on similar job descriptions, job titles, recommendations for trainings, certifications, whatever it might be, pertaining to the folks that do that work in that arena. We haven't even got there yet. We can't even agree on whether or not we can call somebody a community health worker if they only have a high school diploma. You know what I mean? Like that, and like I said, in the meantime, there's potentially a great deal of money being left on the table in terms of work that's actually being done right now as we speak by people who I would consider and others would consider community health workers, that is not being paid for because we can't come to these type of understandings in a more formal way at the state level. So just to recap, the federal CMS guidelines say that community health workers can be paid for the care that they provide to individuals and groups around prevention, and that term is left wide open, right? If it's referred to by a licensed healthcare provider, whether it's an NP or a clinic, a doctor, whoever it is. Now, it's up to the states themselves to describe Medicaid regulatory language to define what a community health worker means, right? And so there's examples from other states like Minnesota, Maine, Maryland that have been doing this work for a long time and actually have legislation on the books that define these things. But the problem is that when you have an arena, and Delaware is not unique in this sense, but when you have an arena where this work has been going on for a couple of decades now, and people are well positioned in their current, ways of doing things, it's quite often very difficult to get people to agree on a training protocol, for somebody under the auspice of a community health worker. So that's where we're at. And Medicaid at the state level is open to the discussion, but they've made it very clear that they're not going to be the sort of authoritative party to define these things without consensus from the current major players, meaning the hospital systems, the universities, and all that.
So I have two questions. So how are you defining community health work? I mean, are you defining that?
Yes. Yeah. So I am, and I'm using I'm using the definition as it applies to CMS right now, which was informed by both the American Public Health Association as well as HRSA, I believe, the Health Resources Services Administration. So, and that again leads to that definition is relatively ambiguous, and it leads to a lot of not clarity in the sense that that it offers its own pathway to defining these things, but I used it in the sense that it was a wide enough umbrella to include the various types of models of community health work. People call community health workers, they might call somebody who we might call a case manager a community health worker.
Right. I mean, that's what I was wondering, on that issue was the difference between like a lay health person who might be working in prevention versus a nurse navigator who's doing sort of case, coordination of care.
Absolutely.
Or a faith community nurse.
Right.
And
so
Leveda's been familiar with this model. The faith nurses have been doing this work, and for decades. But
years.
To answer your question, what's interesting to me is understanding when you go back on the logic model to the very beginning, the contexts, right, and you start to look at sort of the political landscape. The driving for the primary driving force in terms of defining community health workers right now are the hospital systems, the ACOs, and the clinically integrated provider networks, simply because they already have a mechanism. They've established a mechanism through bundled payment systems or value-based payment systems from insurance companies that would allow them to include case managers in that team of providers. And so they've already figured out a way to pay for that type of work, right? They don't need Medicaid to tell them that a case manager can be included in this team of people to help address population health issues. That's been the fundamental pathway that health systems have taken to start to do that work, and that's why it's more of an inside-out looking position than an outside-in, in the sense that hospital systems might parse through their list of all of the people that have utilized the emergency room that month, and they'll identify a subset of those people as high risk, and they'll assign a case manager to those high risk people, who then says, okay, these 5 high risk people, I need my community health worker to go to their house and work with them on these things. That's
the people that they're defined that way, they already have some kind of title, nurse or whatever,
for the most part,
that fits into their funding scheme that are certified.
Sorry, I think we got.
We're running over. I'm sorry. I'll just add I think your research question is actually very good. I think 1A and 1B are technically your specific aims.
Yeah, that's a good point.
That's all I would add to that. So what we're going to do now is we're going to switch back. We're going to do specific aims, take 2. Okay. You guys can go and use the next 15 minutes to work on, individual stuff. Okay. And I'm going to hopefully nuts and bolts get through specific aims, and then Dr. Khan will be here at 12:30. I feel okay asking to be maybe like 5 or so minutes, but not much more than that. So I'll do the best I can, with the promise that if anybody wants to reconnoiter, I will. You guys can go in room 1. I'll come and grab you one. So we're going to talk about the nuts and bolts of specific aims and the specific aims page. For the purposes of this curriculum, your next step is really to take the research question and begin to translate that into specific aims. So that's what I'm going to focus on today. So you have, just a couple of tools. The draft of your specific aims, again, will be due for the January 28th session. I'll probably Now that I think about it, ask everyone at the beginning of that session to just state their most current research question and specific aims. And then the study design experts can help us along. So, actually, I want to skip my little story. The specific aims is probably the most important part of any proposal. It's the first and last section read by a reviewer, and it's probably the one section that every reviewer is going to read. Once you, so talking about reviewers is worth reiterating the NIH review criteria. So in your specific aims page, right, it's like your movie trailer. It's your, it's your 5 minutes to get your foot in the door with these people. So you want to do your best in brief, concise language to get across the significance, the innovation, the approach of your project. And you want, at least a line or two to really convince them that you're the right investigator or investigators in the right environment to do this. And I think that those last two probably especially important when we're talking about community engaged research, because it's really all about the who and the in what setting. Often your specific aims page is the primary communication tool that you use with people. So as you're out there engaging your stakeholders, you want that one-page summary that lets them know, why they should care about this and what exactly you intend to do. Likewise, after it goes in to whatever you're going to submit for, it can be your communication tool for next steps. So you did this in this setting, you have a new collaborator on board, they have some new great ideas, and you kind of exchange this. Simplest language possible. We'd like to think that, reviewers are completely dispassionate and objective, but if you piss them off by using words they don't understand or saying things, in an unduly complicated way, it will color the interpretation of the proposal. And I'm going to introduce just one tool. There are others out there. It's the PICO mnemonic. And what that stands for is a specific aim. The ideal, specific aim should mention the population that you're studying, the intervention or exposure that you're looking for, any comparisons that you're going to make. Now, with our studies, as they all stand in this class, for the most part, I would say we're still in a hypothesis generating phase rather than in a hypothesis testing phase. Fair enough? Does that make sense? So you may not have an obvious comparison. That comes along later. And then you want to have your outcome. And specifics should be specific. So as much as possible, without loading it up and making it a paragraph, you want that aim to really, really tell them what you're going to do. So for the population, this is kind of also a study design question. From whom will you collect the data? And in answering that question, you'll need to think about feasibility versus accuracy. And often they're kind of like in a competition with each other. I always think about the doctor-patient, dyad. Doctors notoriously difficult to get a lot of, information from. So there's a lot of studies out there where actually they'll ask the patient, so what did your doctor say? Is that the most, accurate? No. But, we just kind of acknowledge, some of the feasibility issues. Your intervention or exposure, again, it's a characteristic or event that you think is associated with your primary outcome if it's a hypothesis-driven study. If it's hypothesis generating, it's the characteristics that you plan to observe as potentially related, as potentially important. A comparison, just some thoughts, and again, this is also sort of a study design thing, but when you're talking about the comparison groups, there's a lot of different choices. Sometimes it's just a simple pre-post. So you're talking about measuring change. Sometimes it's a historical group. Sometimes you can go back in the data and find out, maybe you're going to compare to, the people that, appear to have disabilities that answered the questions on the YTS 10 years ago, and then at one point you're going to look at it now. And then sometimes your comparison is simply subgroups. So, you may look at, I don't know. You actually may look at groups of disabled students who are mainstreamed and included already in some of these surveys versus the disabled students who are, put sort of more peripherally in another classroom and have traditionally not been included. It might be that might be a comparison that you're making, not exactly a control, but still a comparison. And then the outcome. Again, this is, to me, I'm always really honing in on the outcome. It's what is the change that you want to see, and how are you going to measure that change? And again, oftentimes, there's that fight between feasibility and accuracy. For you, Levada, for instance, what we want to know is that, thanks, Omar, I'm running just a little bit behind, but, so for instance, for, childhood obesity, your real outcome for your whole big agenda, right, is you want to believe that because of what you've done, there are children who do not go on to be obese, who otherwise would have. However, that's an incredibly hard outcome to measure, right? You need 20 years to measure that.
Yeah.
You need, some pure, untouched group to compare to. So in the end, the truth be told, that would probably be the most accurate measurement, but it's never going to be feasible. And people understand that. There's plenty of things out there in the literature that we've just kind of said at this point, we have to kind of accept that we can't have that gold standard measurement. So even with feasibility in your study, still you might say, depending on the duration of your study, a 1-year study. And in kids, granted, it might be lovely to talk about differences in BMI, but in a 1-year study in children, it might not be that you might not be able to do that either, right? Because their BMIs are increasing. Do you know what I mean? So you're looking at a difference in change from one group to another. So in the end, I think what you're honing in on, one of the things you least, proposed, and this is me just trying to, bring the example into the world of pertinence for you guys. In the end, it may be that you look at behavior change. We have some, and you have a chance later in the grant to make that argument. We have evidence to believe that certain behavior changes are key to preventing obesity. You don't have to repeat that literature. You can kind of rest on what they did.
But would that be evidenced by weight loss?
Yeah. But I guess what I'm saying is, if you're talking about children and an obesity prevention program, and you're doing it for a year, you might not want to hang your hat on being able to show that those kids lost weight for a couple of practical reasons. One, a year's not that much time. And two, especially in kids, their BMI is going to increase. So just to kind of
so maybe there's interim measures. So maybe you get them to they're getting physical activity 5 days a week instead of 2 days a week, or they're eating more fruits and vegetables, so that, and then the assumption is those behavior changes will ultimately move you toward that ultimate goal.
And they're having fun. Sorry, I just throw that in there.
Well, it's interesting. I mean, supposedly we're changing to value all that so much more, right? If the patients like it, if the community's happy, that should have some.
They're going to continue doing it, and that's sort of the longevity, the sustainability of it.
Well, I know in medicine that we're very much it's sort of the new buzzword, patient-oriented outcomes. Because we can do all the things that we want to in the world, but if people don't value them, how valuable are they? So the specific aims page, I just brought this here. We're not going to necessarily get into details, but I want you to see, there's some boilerplates out there. And I know that Carolyn even had yet another. But this is probably, to me, the one that is the most useful in terms of, the one before it, probably, I think, a little too general, and then the one after might be a little bit too detailed for your first step. But basically, on the specific aims page, this is the order that they expect things, the sort of structure. There's an introductory paragraph or two that gets at the what, why, and who. There's a list of the aims, and you end on the sales pitch. Essentially, you tie it into the big picture, why this is innovative, and why you are going to change the world with this work. Get them excited to read. This, again, is a boilerplate sort of structure of that. People say you identify the gap in the literature. You put forth the objective of this study and how it is going to, address that gap. You put forth your central hypothesis. Again, if it is a hypothesis-based study. If it's not, here's probably where you would mention this is a study that is hypothesis generating because this is a really new field. You list your aims and you come back to why this is the best thing in the world, making sure that you include why these outcomes really matter to patients or to the CDC or, and then next steps. All right. I think this is all pretty, okay, so this one's worth saying. Some don'ts for aims. Don't make aim number 2, and I was a little fearful for you, Brian, and we can work on that. You never want aim number 2 to be completely dependent on aim number 1 working out. So they always say, well, don't say I'm gonna validate a tool, and then I'm gonna use that tool to show that my intervention worked. Because if they're gonna say it's a fatal flaw. If your tool doesn't work, you have no way to measure. And I don't want to fund that study because I'm not sure that it'll work. Yet you have to walk the line. Your aims should be related. They should have a sense of consecutiveness, consecutivity. I don't know. They have a sense of being consecutive. They should be interconnected but not dependent, logical, stepwise. Really, you want to stick to 2 or 3, no more. These are some words that you want to think about with a specific aim. So now you're no longer asking a question. That's the research question. The aim is really an action. We are going to measure pre, post, self-reported consumption of fruits and vegetables in individuals who are touched by our community partnership between a faith-based organization and a civic organization. Make sense? So I just put all those verbs up there because sometimes for me, it just helps to have the list. It kind of prompts me to put things in the right terms. So specific aims are declarative. And there's that structure again. This is just a repeat. And that last paragraph of specific aims again, I told you what that's supposed to have. These are just some things that these are some cheating phrases. You can say it again. This is the first attempt to test the feasibility of this intervention in a partnership between civic associations and ministries. This is the first attempt to understand the differences in the disabled population in Delaware in terms of who can and does participate currently versus who does not. Words like state-of-the-art, emerging concept, that kind of gets their attention. We're completing the understanding of an important problem. We're understanding and advancing this problem. All right? I know that was fast and furious, and I'm sorry, Omar, for making you wait.
No worries.
Questions? Pretty. I mean, it never sounds like rocket science, but I do.
But it's hard to do.
It is hard to do. It's like standing up here and talking about it makes it sound like, why do you even give a lecture on that? But then anybody who's really sat down and tried to do it, you're like, this is not easy. All right. Let me go. The other team's next door working on something. I'm just going to give them the heads up to come back, and we'll get started on the Are You Ready? Did you get lunch?
I didn't. I wasn't sure if we were going to.
Oh, no. Go ahead.
Okay.
Yeah.
You're talking first?
Yeah, I'm going to go first anyway,
okay,
so
grab a little bit.
you won't have to worry. This is all, everybody's eating, so this is, you can eat all of it.
Yeah. Grab a lot of it.
Eileen.
Eileen, go, nice to see you again.
I feel like,
We met on the first day when you had just received your award with
it
the
seems
reception.
like
Yeah.
it's taking a little bit more shape.
So is this what they
And the process
It is. We've been trying
with
to,
the-
formulate some of
we
these
in
things.
this
You know,
instruction is like that.
I know,
To
this was good that he gave us
Stuff like that.
these products that we have to get.
So,
Okay.
I didn't want
Because
to
we,
bring
like, we're
everybody
talking
together
about them and we're sort of
until
getting into some of
I
these issues, but
finish
we haven't,
this.
you know, I have to go back and look at
So,
our mentoring.
I think
when
program
we
deal
actually
to really do them.
start,
I would say a
Part of
part,
the-
like a
part of the
march
book,
start.
I think,
Yeah,
right?
And who's,
start
I
in
forget who
terms
said
of,
that was.
Mia Pappas.
Mia, okay.
um,
Yeah, and I
you
think
know
it's
what I
first,
mean?
Well,
especially when someone's peripheral.
the
to
training,
kind of,
the
you know,
academic
so they have
training
to-
of the part.
I'm very
Put
good. How are
their
you?
Did you want to find out now? You know what I mean, and vice versa. You know what I mean, like, what are you expecting from her to do?
Yeah.
It's kind of just, if you think like the mentoring is just honing in on one very crucial aspect of the team. So, and you know, I don't you can let me know if it seems like as we go along,
Yeah. I mean, I think a
Yeah.
part of,
but it's hard for me, I don't know you.
part of the benefit of having
You know
this
what I mean,
time
I actually, it's funny, because, you know,
might
we were
be
getting,
speeches
there was
with
something,
some
and I was like, oh yeah, because Steve Martin's in charge of evaluating the whole CPR, so I need,
feel as to
that's
just
really
how nice
weird.
it
Do
is.
you know what I mean, like,
We're having that conversation downstairs because, because I'm like in some things, like the city stuff I've never done before, so I'm giving him my feedback on that whole thing. Yeah, and I'm gonna be looking at it, he's looking at it
At one
from
of our
perspective
regular
of
scheduled meetings to take some
Yeah.
time.
like, because each one has their own
Give the information they
processes and
need
so
to
forth,
know
and
in
when
order
I have
to
something
know
that's
what
more
their
in
role
common.
function
Right.
is.
Well, it's better than it used to be, now that they're all in the city, they used to have their own
But you know, I
in
love,
Jefferson City too.
I loved the in-person
setting like
program, like,
this.
UD used to have the woman who
Yeah.
used to do it, Jody.
And I'm not
Or
sure,
to
you
pull
know,
people
She
from
was just, it was
different parts of
like
the
an
state together,
entertaining
so
lecture.
everybody
Really?
can
It was
sit down in
really
one session.
fabulous, you know, and
Yeah,
you're thinking,
I'd
really?
rather-
But trust me, it really was, and so now,
Huh.
because she just, you know, she
no, I'm not,
included all
I'm
these
not,
stories
I'm not
about,
sure
you
if
know, just,
the full scale
You see that being
of
easier
what
to
it
do
is
than
that we're
trying to
doing
read through this
on a weekly
stuff
basis.
that's really dry.
and she captured, you know, I think she just used the examples of the studies that had just,
At the very
you know,
least,
gross violations,
I think
you
at the
know,
very
that when
least
you
the
use
the
those as
information
illustrations,
that
it
is
just made
made
it more
available.
entertaining
Yeah.
and, you know, share those
The
comments.
state has
It's
things.
still in session.
As far as I know,
Really?
they
Be good.
I don't remember any requirement, I
Yeah,
never had to
we
do
just
that,
had-
you know, when it first
Oh,
came out,
it's
just
a
reading
professional
it,
network.
trying to put falls under one
Under
and so forth, so I mean,
conditions that
that may be
you
another
are
area to
approaching
potentially.
That's probably.
I'll tell you, I'm glad it's not my,
as a partner, as a request to partner.
Oh, yeah, it's got my
that's the liability.
Like spirit.
As you're working,
Now
so,
especially.
And the night, you know,
Yeah, we were both
I
talking
think,
about it then
again,
last
that's
time.
sort of a
With
smooth extension of,
so
if you
there's
do
that
something
we're
like
struggling
something,
to hear
I've been able to
as
just say step
very important,
into,
it's something along the lines of,
you know, I'm good, I can see,
you
you
know,
know, like, yes,
presenting
you are,
this
check,
in terms
you know,
of
as opposed to,
boundaries,
you know, if
making
you let
sure
it be
you-
more
Does that-
making
core,
sure you
Right, right.
then,
Does that feel?
you know, when you collaborate, you know what I mean, like, there's trust, right? You know what I mean, of course you can trust their people to have delivered the course well, you know, they sent them, you know what I mean, but then it's the Shannon, trust them.
And that's the thing, is there's
And it
not.
doesn't meet all of those different, with
And
the
they-
So I
curriculum,
think that's gonna have to come
you know,
out
have
of
we
a little
covered
bit more planning
these specific areas that
through
relate
this
to that
process.
kind of.
Right, and there's different, it's,
In
you know, I
terms
know
of
there's
what it
different
is
needs, because
that
there's
you
like
think
different,
there's
different modules you have to take for
Yeah.
Christianity, you don't have to take.
Chemicals.
I wanted to learn everything that I need
Alright.
in order to pull
Bum, bum, bum,
everyone
bum.
together and then get the commitment and that's why I keep going back to that good fit
Right, right.
of who will be,
I think also you might, I mean, even having some informal conversations, not, I mean,
Well,
given a,
it'll help.
or your
You probably already know what that is.
I did, that's why I had gotten one on the back.
Like a tree, like you would put up with, you know what I mean?
you were playing like old fashioned movies.
And then saying, look, nothing's finalized yet, but we want to be able to make sure that if we are able to take the next step, that you're on board with this. And
Really? Do you need me to click through slides, or so you can kind of do your thing?
No, that's okay. It kind of keeps me, it's like my thing. Walking around. All right, so we're going to get started, hopefully taking off on time so we can land on time. Good news or bad news, I think both Dr. Khan and I are fairly fast talkers.
All right.
So, we, if left to our own devices, we would probably move this through on time. However, I will personally say that, you're welcome to stop me and ask for clarification. My goal here today is, though, to have minimum amounts of me talking at you and maximum amounts of you guys discussing amongst yourselves. So, 2 minutes or less of me or Omar talking, and then the structure will be that the teams will work for 10 minutes, and then we'll come back together for a whole group discussion in 10 minutes. I will put my phone on and time things, because otherwise it just, we're all excited to be here and have lots to share. There's only the two facilitators of myself and Dr. Khan, so we will each work with a team during that first 10 minutes. And the teams that we don't work with will be the ones that lead the sort of 10-minute group discussion then. And then we'll switch. Make sense? It's the best we can do to kind of feel like everybody's getting their share of love. Today's plan, we're going to talk about leadership, inclusivity, competency, and resources. That would be chapter 4. Then I'm going to hand over to Dr. Omar Khan. Do you guys all know Omar?
Yeah, we met at the reception.
Okay, all right, good. And then Omar will take over for Chapter 5, Communication, Decision-Making, Equitable Contribution. I think I have that right. We'll see if I'm doing all that and he's doing all that. But, and then Chapter 6 is really summarizing the whole deal. We're going to let you work on that on your own.
Okay.
I think you would be really tired of teamwork if we just kept plugging through all that in one day, personally. And honestly, I just think it's probably a little bit better to go home and digest all the components and then, let things begin to crystallize. So the first idea here is the capacity of your partnership to do this project. And capacity is defined as the ability and capability of the partners, the organizations, and this community to conduct your community-based participatory research. Key indicators of capacity are, do you have an effective leadership? Do you think your leaders have what it takes to move this group forward? Do you have all the right members? So inclusivity. Do you have complementary competencies, complementary skills? I'm going to change that next year because that's hard to say. And do you just basically have adequate resources? So leadership. You need to stop and assess the leadership of your team, considering the complexity and skills required, people's experience, expertise, and credibility with the community and other stakeholders. So the obvious example here is, if I, being, a Caucasian girl that doesn't even live in Delaware, decided that I wanted to go into, the Southbridge community and I was going to change the world and they're all going to listen to me, I'm missing some key partners. You know what I mean? And you should doubt my leadership. All right, so then you guys are going to work on your own for 10 minutes. Pages 40 through 43. Use the team discussion and the action notes to kind of guide your discussion. And when we come back, we will take 10 minutes to discuss this question. What are the leadership qualities you expect from your team? So, let's see. We're missing a team, Omar.
Okay.
So, actually, only one team will be without a facilitator. So you know the projects too, somewhat, right?
Somewhat of a part. Yeah,
Okay. Why don't you start with these guys? Okay. And since I worked with you guys last time, I'll let you guys be solo. I'll work with them, but you'll get to present for the whole group.
I'm good. How are you, Dr.
All right.
Wait,
That was
All right.
So, what are the leadership?
We're all realizing that there's a lot of transparency and that everybody's sort of unequal, but so to me, for us, and since we've got the
And your 10 minutes is officially starting now.
So, I think,
Well,
yeah.
the first question is what leadership qualities?
no, so I think one of the things that I was thinking about was kind of,
Partnership.
you know,
I get it
you know,
as
sort
an
of
individual.
seeing
Experience and
the-
expertise in the
We're discussing
kind of field.
where this could be, you know what
I
I mean?
think there
That
are
was kind of
teams
a
that
lot
everybody's
of
really on
The
it.
credibility,
And even putting, like, I mean, there's no
um,
way
the
for
time commitment and availability.
for anyone to do any of this research
Energy
without
and
the
passion.
of the other party.
And really, I think
Like
trust and
with Sean
respect
for
should
just
have
like
been at the,
years of
at
being
the
invested
top.
and
Yeah, I definitely, I think it's like following
you know,
which I think
we
is
don't have it, but yet
really
we've got some
important.
sort of research capacity. So I think between the fact that we're kind of
Well,
level footing,
so, yeah, I'm a
more
system.
complementary, I think in terms of that's gonna drive how this project.
Right,
Right,
right.
right.
Yeah, lay out for me, you know, in your mind.
Well,
And that's why I think that when I was thinking about what I was really
so
thinking about,
I think,
It's
you know, the
distinct
time.
I think a number
Setting the
and what
time.
you're
of
gonna
the
do.
factors that you pointed
Yeah, in terms
to,
of leadership.
particularly
Knocking things off,
experience,
you know, to move, to keep it
and
moving
and
forward.
I hope
But I
my
think you've
expertise
raised
and
another one, and I
credibility,
think one of the important things here is
lend
that
themselves to
relationship
trust,
management.
respect, and
Yeah.
the problem is
Partnership.
sort of what is the,
Yeah.
what's the, let's say, how does that pie break up? You know what I mean? Like what percentage of which is valued depending on the community is that you're talking.
I mean,
You know what I mean?
Well, you,
So
I'm gonna
if,
invoke Carol.
like I could bring somebody in
I'm gonna
who's a
invoke us.
world-renowned expert in child
How
abuse
many?
and has published on
So, like,
What?
you're ready.
I need my southern
That's really
accent. I gotta be real
good.
slow. She's got a very like
That-
beautiful but gravelly southern.
to treat something
How
sort
many?
of
Picking up on it earlier,
What?
you know,
fleshing it out, maybe some
Working
of these,
with
I think some of these exercises.
it may necessarily be somebody who has roots in that community, who has been doing community organizing or advocacy work in that community for, you know, a decade, you know, or somebody who is recognizable by face on the street, and you call out somebody's name and they'll turn around and say, hey, you know, that's a completely
So I
different
hear
type of credibility
ambassador
than just the, you know, the bona
to
fides
perhaps an already
that
existing
come with
community
working in the
of
academic
cancer
world.
care donor.
I feel
And I
that
hear access to population.
with myself and all the community partners,
So I was gonna say like,
we've had,
budget
Is there
particularly
anything
in terms of the health and the subject of childhood obesity, we all know something about it.
Being able
But we
to track
haven't
that or make sure
been
that somebody's
immersed in
tracking
it.
it.
and you're a service provider in this area.
And we're coming
which is
from-
huge. If, you know, the first time we had
It's
talked,
driven
and you
from
said,
a
oh, I would
different,
to support of expressive
from
counsel,
a-
it probably would
initiative
have been a great
other than
conversation, but it wouldn't have been.
out of something like my focus is how our health ministry
You're already
is
doing
established.
where I just put responsibility.
In my mind, that's
So-
the way, one of the reasons
All
why
of our
you're a
nurses
leader.
in my sorority come from different occupational settings.
Yeah.
Or because I'm interested.
It's only driven
Both,
from
yeah.
the top down.
In terms
Type
of
of thing
your
that's not really
personal
been a focus.
career,
Their focus is more political than it is on health.
if this is
So,
successful,
to me,
what will that
gaining
look
the
like?
knowledge
What are the
and,
expectations?
I hope, what, I guess.
enough of the content so that you can share with those that you're trying to
Another
influence,
kind of process.
so that they can buy into it. That is, to me, the key
It's almost separate, you know, one
piece.
is.
It's a foundational piece on which these other things
May not be,
There's some physical activity.
but I guess that
What
falls
Scott
under
was saying sounds
some of
like
these
it
other
is
things.
program
It's just one of the
was able to translate
pieces
those pieces.
of the.
That is,
So
if
you
bring in the experts,
are an advocate for your
who
population,
then would
and you are
receive trust
at
and
least
respect
have a
because
hunch
their
that there's a
connection with an
resource that
established
they
community.
need to have.
Yeah, and I have, I guess the way of putting it's a hunch, but I don't have a whole lot behind it other than a hunch. I'm hoping that this will give me a lot more behind it in terms of either the funders are going to just financial regulations, so whether there's this really cool thing I'm working on. Nice.
And that is what one of the additional partners I thought was
To take that one step further, you put us in
state health
with something
initiative.
convincing, so that you can really say, refine your ask, you know, and make an argument why this is truly a need.
I am
Is that fair?
Yeah. Well, I think so far I think we've worked collaboratively very well.
in all these organizations.
Sharing things, bouncing things
And
out.
bringing them together to me is, I told Brian, it's secondary to what I wanted to do.
I mean, that's,
I'm
that's
starting
what I'm
to
saying, I
like,
think
I know
it
it's
is-
only 2 weeks.
this whole
That's
program
what
is
we haven't
kind of
really
just so
started yet, right?
drawn or other somebody wants to offer.
But I'm just already
They
starting
will
to
help
feel
her,
that
there's
it's
a
gonna
little
be
bit of
a
a
very,
principle
it's a very
somewhere that
ambitious.
needs to be done, but you're right, there's not a lot of,
So
there's not like a
it's
whole lot of
secondary.
information.
Really need to get
It
this
will happen as a result of what we do
Right,
to educate
You know,
the parents and children towards
So
being.
is that what you guys first
And
told
we
me?
think it's quite obvious, this is sort of the calling
So
part
let's-
of
why don't we
coalition,
make it a
coalitions and what it is that they
And I think,
take
you
is
know,
not
and then-
necessarily where the sum of the parts is the benefit of the, having people take the time to volunteer to be a part of something that they're not necessarily getting paid for, but there's a shared appreciation for the
Well, we
value.
don't have anything to, I want to detail,
So, you may not necessarily, you know, I think the key element here that you pointed to is somebody that can translate that space, and Omar mentioned it, and that would be you, and being able to connect
Okay,
these
so
pieces
should we?
as a whole, you know what I mean? So whether it's content or, you know, expertise of established coalitions like Q or Healthy Kids
3-minute
Delaware or
warning.
something like that. And which may be outside of the
Enough
box
to
of your, of the current reach of the health ministry and folks that they haven't traditionally reached out
This is your first time
that
partnering,
the
right?
connection
It's
is
the first time
what's
it's thought.
For us,
so.
no, Sean's
It may not necessarily-
yeah,
Oh, okay.
yeah, sometimes we're like,
I think,
but it's
no,
my first
I
time
think
with.
you, like Omar said, you hit all the major ones. I think the only difference is now something that you've mentioned a number of times now, Loretta, that
Yeah.
is always on
That's usually how big the cancer
the
works.
So I'm gonna
Are they
put
the right people to make, to cover all of these
So I think
bases?
a lot of
You know what I mean?
Yeah,
Like,
let's
are
go
they
with
the
that.
right organizations? Are they the right
Give
people
anyone
from the
a bad
organizations
face
to
or
cover all
comment
of
in
these
the car
bases as a
during the
whole?
meeting, because
You
chances
know
are
what I
you're
mean?
married to your boss.
And I think at the end of
Either
this
at the meeting or
process,
married to your boss.
in terms of
Like a
trying to lay out the
personal
line,
So we have
you
idea
did say, you know, I mean, that you think that the right
How confident are you
organizations are
in
there.
this partnership?
But it's,
Or
again,
better
it's
yet,
getting,
what,
it's
you
getting
know,
the
what-
right
what are
representatives
some
in
doubts
those
or
committees
concerns?
to make sure that, you
I
know,
think I can have that together once
About
I
We
know.
do, I mean,
your
and
research
these so
partnership
once I know
and
who
go
else
with the
is-
research.
And you can think about that in terms of this specific project, or, I mean, really, we don't wanna do one and done, right?
So we have to put aside,
You know,
what are some of the doubts?
I mean, I guess my huge concern right now is just, and it's not about the.
well, I think
It is
your
the
approach is the same way. You can look at this as either,
part of just
the
how
qualities of
how
leadership
Right.
element itself,
Yeah,
or
we're breaking
leadership,
it
and
down.
you decided to take
Scope.
sort of the
Right,
more
and you know, we have
internalized
these
approach,
Sean does
which I think is
ton of
very
really
It has
good
that
people.
language
Scott
on
knows
that
why
particular
somebody,
day,
someone
something
better
bad.
draw the line.
Yeah, I know, I think
We
we
go and talk to just in
then,
terms of the
But
time.
so we
have
can,
looked
so
at
maybe
some of the
we'll, if we
qualities
put that on
that
our agenda for next week, we can look
areas
at
that
all of
bring
those
to the
pieces
table
and see if we
will
want to
help
meld
you
them.
to identify the
be-
right people.
So, how
That's a
can
different
that
front,
and
and
I
that's
think,
one
for
where,
disabilities and
You know,
wheelchairs?
this question, what do they expect we
What are
have as
patterns of
responsibilities?
participation
If we're talking about
that's
you,
my big concern in
the
particular.
primary one, other
population
than
accommodation
being able
around
to put together
We
a
wanna
a
hear
programmatic
from
plan or
you.
some
We have
sort
some
of
point.
is simply is to play the connector because other people can help you.
That's where
You know what I mean?
not sure.
I can't necessarily help you with
Well, I just
making
copied
the
down.
connection between
Yeah, they're-
the local president,
No, of course,
the local chapter
When she did it, yeah, it was
president,
like-
president,
Right,
and
Where you draw the line.
the
If I
faith
can,
ministry
right.
representation that you would want on
So
that
that's
committee.
what I'm.
But I can help you with putting a lot of people together to show them and say, this is what we think the overall picture is going to look like. You know,
I think, when we were
Like
talking
we
about,
before, there's no shortage of people
what
that,
she was talking
you know,
about,
I have a friend and he has a friend and so on and so
So I
on and
looked,
so
and
on.
I went back
Specific-
last night.
Do you share
Specific
your
names,
theory?
yeah.
I think,
I went back and looked at our work plan, like the timeline, that one that we banged out. It's not bad.
What do you mean that hard something?
We had one in the work plan, and then we kind of plumped it up a little bit.
something
So-
real long.
Right. And that's what we're trying to do here, is to take
All right.
schedule first help you focus. And a lot of them will help you present it in a picture, in a simple way.
Well, I think we
People
need
can
to schedule it,
I mean, that's what we're
so we could schedule it for the end of February.
That's fine. Yeah, that's fine.
Sometime in February.
Yeah, I think that's okay.
Yes.
I already feel better.
All right, everybody.
Or like a webinar.
We're gonna then pull in for the group discussion here. It's interesting, because I did think about this with 4 teams, and we have 3, which is good. We actually have more time than we thought. So maybe what I'm gonna do then, for the group discussion, I'll let the whole 10 minutes focus on the team du jour, and we'll just keep rotating that.
Team du jour, I love it.
Yeah, so like, the team de heure.
Team de minutes.
Team de minutes. Oui. So I'm gonna let you guys go ahead, and do you need them to say a couple words about their project?
Sorry, did I? Yeah, that'd be great, actually. Thank you.
Yeah.
Just like a sentence, so I can refresh my memory on your work.
So we are focusing on the youth tobacco survey, which is done through public health in the middle schools and high schools. And our focus is trying to expand the number of students with disabilities that participate in that survey. There's kind of a protocol right now that excludes a certain number of students, and we think there's room for moving that threshold of inclusion.
And Steve's part of your group. right?
Yes, Steve Martin.
Great.
Yes.
Okay, so we are gonna talk about that question, and we're gonna talk about it for about 10 minutes, or less if we. So, what are the leadership qualities that you expect from this team?
Well, we just sort of listed some things out, so having a clear vision of the project and the goal and the aims. So that would be kind of one main thing. Then having organizational skills to kind of pull the group together, to do the follow through, keep the timeline going so that we're on schedule and we get to the point we want to be at the time, because it is very time sensitive from the aspect of when these surveys are actually done in the field. Those are kind of our anchor points, and we're kind of hoping at least to make enough progress with this research project to be able to do some more inclusion in the next round of YTS, which is next January. Then the facilitation, relationship building skills, being able to anticipate conflicts, barriers, and those kinds of things, and hopefully as we're learning, this process here is helping to strengthen that for all of us. And then sort of from the fiscal end, sort of maintaining the accountability, reporting, and just fiscal responsibility of the project. So those were kind of things that.
And it's the leadership of the group, basically the 3 of you.
Yes.
So this is really an internal map for what you expect from yourselves.
Yeah.
Yes.
Yeah, it is.
Okay. That makes it interesting, right?
Yeah. Do you have a sense of those domains listed? Is there already a sense of who's doing what? Is it
issues. I don't think we have, I don't know, I haven't.
We're not a shy bunch.
Yeah.
That's good.
Well, I mean, it's always wonderful to hear, and I don't want to be the voice of pessimism. But eventually, even today, some of it will come up. You'll need to ask yourself some questions about who's, in charge of what and what happens with conflicts. So, for instance, there's going to have to be a someone or someone's who says, yes, the money can go to that. Or someone's who, either individually or collectively are going to be responsible for, like, you tried to charge a cost center for $5,000 more than you have. Or, authorship, right? And I would just, throw out there for your comment, for me, working in research teams, seems like the best idea in the world. It's absolutely the way we should be doing this kind of work. But I can tell you, rarely do you get this opportunity up front. And it's really hard sometimes because in classic research, I think, and there's still the residual, there's a point person. There's a principal investigator. And somebody, you know what I mean, like, you'll like on any team or committee, you'll feel like sometimes, it's like, if somebody doesn't step up to be that, everyone would talk forever. Does that make sense? Mm-hmm. Have you guys thought about that? Encountered any response to what I said? Crazy?
Well, I didn't think about it. I mean, I thought about it up until the point where you mentioned finances. Mm-hmm. That piece, I have to admit, I have a weakness for, and I didn't think about when I was thinking about the project, about the partnership. When you talked about ownership, thinking about spreading the money, that I didn't think about that. If there's going to be a conflict around, well, you're getting more for this piece than I am, and I could see some feathers getting ruffled. And I hadn't thought about, because we all love each other.
Well, and just like we had rules that we put forth about the budgets for the RFP, just join in, Liz. We're talking about this is what we're talking about. It's not there anymore. We're talking about leadership on the team.
Leadership on the team.
Yeah.
Said we all love each other.
We love each
other.
They're saying how much they love you.
Oh,
You missed it. Sorry. And blue jeans was out, so it didn't get recorded.
Oh, okay. Darn.
We were talking about leadership and finance, and what I was going to say is, when we put out this RFP, of course, I had to work with leadership within the CTR to see what rules we were going to put around the money. Mm-hmm. Likewise, you may have some sort of subset of rules within your team, and you're going to have to, have some sense of are all those rules going to be decided as you go? Does everybody get an equal share on those, on creating those rules? Blah, blah, blah.
And we did address some of that already when we were planning the grant, because we were strategic. It made more sense to go through Steve's college than my college, just for some financial.
Path of least resistance.
Well, it was more around flexibility, I think. I'll leave it that way.
If my boss refused to
Right.
have it go through the state, forget it. You'll never get it done.
Right.
So it was pretty clear.
Well, here at Christiana, I have no idea what you're talking about.
No.
Yeah, right. Always simple, straightforward.
I'm sure.
Other concerns, thoughts, things you want to talk about before we move on? Anybody? All right.
Who would be your fiduciary? We'll say to be determined.
All right, so the next concept I'm going to ask you all to consider is inclusive membership. I don't know, do I really need to read all this? I mean, I think you get the point that you want to include influential members from the community organizations, partners that are needed to carry out the project, as well as, thinking about the people that you're going to need for sustainability, to make the social change, to take the next step. And frankly, I don't want to get myself in trouble, but I know, there's been some projects where I've been point blank told, if you don't include this person, you're gonna get stuck. You need to understand. And we were talking a little bit about the lay of the land in Delaware, and sometimes it is just a small place. So, obviously,
And the Delaware way is real. The Delaware way is a real.
Is that always a negative?
Not always a negative.
Anyway, so obviously you want to think about things we've already talked about: leadership, expertise, knowledge, cultural competence, credibility, and experience. So we're going to break up and go over pages 44 through 45. When we come back, we are going to ask this question: who are the key members, stakeholders needed to maintain the viability of this partnership, the project now and the project over time? So, let's see. I'll join you guys. I'll take Omar. Why don't you join them? And then
44 and 45.
we'll let Liz and Levada. When we all come back, you're not getting a facilitator. When we all come back, we'll focus the discussion time on your projects.
Okay.
Okay. That makes sense. All right. And so.
Even though I missed this morning.
And we're really, so
This morning was kind of
this
its own
question
thing.
is
We're just
really
doing
Sean's forte, because he literally knows
So we're
everybody in
gonna
the state. And
start our 10 minutes now.
And then with the kids
Oh,
in the
okay.
community. But you just,
Membership.
because you live with a number of different states.
Yeah, well, we're located in Dover Beach, so I can provide the service.
How do we figure it out first for ourselves?
Also, some work programming.
Well, we talked about
A little bit
some of
more
the
sense.
So we have
And so, the only thing that's offered to
Because we have kind of disability council folks that was talking about. So we have that doing representation, but we also have some.
That is what I have
little
to
challenge for me, I think, in terms of getting folks that
I was also
are,
thinking about
leadership.
school nurse that sits on my,
Yeah.
school nurse at Richardson, which is all special needs kids in their elementary school.
folks,
I'm pretty confident, and I'll put that as
Western Sussex especially.
Sorority.
Yeah, and just with this,
Either be on it or
Programs there. I think we'll be able to.
sorority.
Only thing, not so sure about Kent.
so where we just help us.
I was
DR,
actually thinking,
We're going to assess the.
It'd be great to get
And I'm
Prince
so
along.
That's pretty, he's pretty confident.
It goes up there.
Or the
And I think, you know, I think
working
once
specifically
I know about the
special
English,
students.
about the moving forward, and I really didn't want to,
Yeah.
as we had discussed before, really bring our partners together until I knew who was in place and who I could count on. One of the things that came out
Oh,
of
like
helping kids know where
you mean like speech language or OT or something like that?
Brian for Heal. So, I'm gonna bring him in. Yeah, because it is a state.
And then the other,
I'll get them on.
so we also said like DATI, like assistive technology.
I just want to be clear. That page and sorority and diversity and Delaware here as sort of administrators, organizers, stakeholders, and so they don't like have schools and
Yeah.
incentives that were more needed for that.
It wouldn't be schools.
Not schools. That's right.
These are going to be neighborhood civic associations.
Civic,
Church? Just the churches, yeah, the churches and the neighborhood.
Well, I would say that's
Yeah,
it could be a
Or they keep the staples in any given area for them to get the yard notes in the community, but in practical terms, yeah.
the churches were the hub
Where the
The health ministries and I'm trying to entertain the NPC.
Right. And also, like,
Same law.
Gotta get that out to NPC and
Is the neighborhood planning council.
oh, the neighborhood planning.
Connected with PANCAN.
That would be the civic association or something. You know, and whatever PAL center, neighborhood center, whatever's in that locale.
So in a particular area, it may be the health ministry, MSA, maybe the health ministry nurse in a particular church within this NDC, but it might actually take place in the house.
Well, I mean, they'll organize in their church, but hopefully there's.
well, I don't think Vince, the guy that I reached out to,
Because
I
they're not
don't
coming
think
to
he's
church.
the right person.
So that's
We're
why.
out.
Well, first of all, because he was on some detail,
Okay, neighborhood center.
well, no, he was still in Atlanta, but he was working on some,
We're gonna implement a program.
But the
evaluation of
neighborhood
some
planning
public
council
health
is sort of the organizational body of the sector. It's not really a place.
Well, I think
Right.
I lost my way.
Or the
They're
connectors.
the smaller civic associations.
Connectors with the
Shuffling around.
So those are the natural health.
So you have to answer this around each part, this is how each part is priorities. We know the sorority.
Well, I'm gonna,
Would you say that the sorority and the health
what I can
ministry
do is
nurse
come back when I
network,
sent that
and
out
with
to
some
Vince.
degree of confidence,
We have,
maybe Delaware, maybe less so, but they would be, you could probably answer this.
Euro
I love the questions.
Answer these series of
Oh,
questions.
yeah.
branch, it's a branch, I think.
I didn't do that because it was,
director,
well,
chief,
from
or whatever they call it.
individual
So
standpoint,
she,
I
at
can't,
that
not
point,
from
she's
the.
been on board like, and she wasn't right, so I had copied her, but I never had a discussion with her about it. So I think the right thing to do would be to go back to her now and
Yeah,
say,
see,
shared
skills and abilities.
That's
that
kind of
really
what
work
our-
for someone, and I think it
I
should be
learned
something
that.
that's disability and health
What
too.
a question or
And they
study
have like
is
an
what is
evaluation,
what
they
is
have
the
a
score
program
on
to
this
do,
for
and they
versus
have
this book?
research and
So
evaluation.
certainly something like that can really help us get us both.
So I wanted to do that with the
Yeah.
partnership.
Maybe get to
So, but,
Rather than
I
based
need
on
to,
my
some
they're really kind of doing
So,
the show
like,
right now, they just had a whole bunch of new staff.
You could do this like your own self-assessment, and then you
Yeah,
can see what
I
they
did,
think.
I did, I didn't put it down here because I'm over copy this.
Got it. So I would think that you have.
Oh, yeah, I mean, I think we could not involve CDC
Where
and
do you think
and
there'd
take
be-
it to CDC, but I think there's
Grant
value
writing,
if we can engage them
wherever
and get some insight from them.
Research.
technical
What
IT
would it take,
skills,
from their perspective, what would it take to really change practice, to change that policy?
3-minute warning.
That could help us.
research methods, data analysis.
They're all weaknesses, yeah.
Yes.
Within your budget. Although he'll, that's just a matter of how in deal's gonna be.
And you also have to consider too that like
Well,
Excel itself is
It's hard.
Is that
Yeah.
like Allison Health?
Well,
and the
Or is it,
resources
is
that
it?
you compare through Excel can potentially side of the graph, like the IT, the
Data analysis.
and that's what we're here to do, to support that.
Think of Excel as part of it. Yeah.
They
sort of cross over a lot of elements.
Right. Say,
You're not gonna have any planning council or anything.
You're not gonna need, yeah, of course, like that.
Yeah.
I think think the core thing that's important in what we talk about is being able to make the peers and then have that connection stick. And it's the infrastructure. So we already saw it. Indicators of goals, right? Making it stick is going to be utilizing all the resources that you're identifying.
But I think one of the things
so that so all the partners can look at it and say, you know what, not only does this make sense to me and I see the importance of it, but I can see where my role could be.
They just see,
I can see
setting this,
that
here's how we're defining the
I'm
population.
input here and I can help drive an output here. You know what I mean? Like that's a huge value that I've found in having
Yeah, but you know what, with Liz,
simple.
So visual.
But that doesn't mean,
It doesn't mean. You can sit there and have a circle. Where do you think you contribute?
right, but I'm saying in practice.
I think that would be very helpful because
Right, so my point is,
trying to describe.
So we were just saying that before, we want to make sure that we have
Like I said,
You asked me
and
that.
We're going to do it correctly.
that's why what you and I talked about.
but I don't think I don't know that
was helpful
they
in
receive
because
it at
I
that
was still trying to figure
granular
out in
level,
my head, well,
you know, that
when you
if
talk
there's
about
kids in special ed classrooms who really can participate
and you
more.
talk about the big basement, I generally have an idea of what but getting to the specifics
Right.
of who is who and where they
Right.
sit in the strata, so to speak, like, is it a national approach, is it a local approach? Like, that's all we're trying to flesh out, so that was the trick.
So what is
Right. It's low hanging fruit.
exactly.
Right, well, that's what.
how we are able to complete this?
Is that discussion of
Who are the keys members of the VOT meetings?
Yeah.
Well, you have
that, or do that,
And
bend
I
that,
think
or
it's
whatever,
Yeah.
you know, and
Yeah,
it's
yeah,
very
yeah,
clear,
yeah.
slice
You know, like you said,
You do.
for all these things that we thought.
but they're being excluded, and so
Yeah.
that, that sort of raises the question.
All right. Solid partners. It's time to be done.
Actually, I don't know.
So you're firmly entrenched. Sal helped administrate and sorority.
All right, so it's between.
Started out there.
It's sort of like a superstore that comes on yourself and,
With one
Yes.
question, one guy.
So Liz and Lily, if you guys want to split the time evenly, we'll have 5 minutes for each of you to talk about the answers to this question.
We're answering that question, right?
Yeah, for your different teams.
for the different, oh, okay.
We just talked about, for the child.
Per team, but I can,
Okay,
health,
whatever.
the community health worker team? Yeah, I can.
Yeah, okay.
Okay.
Key members, stakeholders, have identified, the Delaware Regional Health Ministry Network, Tau Eta chapter of Chi Eta Phi Nursing Sorority, Inc., the NAACP, chapters, Excel and HEAL, the Delaware HEAL, are my stakeholders to maintain the partnership over time. The other partners would be the local health ministry network and local civic. I was going to say NCP, but civic associations, neighborhood civic associations.
Do you think that the key stakeholders are going to change over time, whether you're talking about this project specifically, sort of who else might you include, who else might you include along the way, or how might you deal with other people who are like, hey, I didn't, I should have been on your team.
And I failed to mention Healthy Kids Delaware because that's another group that we're associated with that has a stakeholder. So, I mean, the individual people may change, but the main stakeholders will not. They'll be there.
So there might be churn within the individual representation from the stakeholders, and I think that does oftentimes present some issues in terms of getting new people to buy in or figure out how they can identify themselves in the bigger picture. You know what I mean? But overall, I think she's got a good idea of where to draw those individuals from.
I like your distinct groups, the Health Ministry Network and the sorority and the Neighborhood Planning Council. They're like different but related constituencies. When you get to Delaware Heel and you get to Healthy Kids Network, a lot of people wear the same hats. They're on that and they're on that. So within those two groups, you got to get the people that are going to dig into your project. Do you know what I mean? Does that make sense, Brian? Because they're looking at a lot of different things.
Yeah.
I think the Delaware Heel and Healthy Kids Delaware, to me, they are the ones who bring more credibility to the other groups that they could be associated with. That they could associate with and get some bragging rights and.
Yeah, and it's so what they've been working on. It so speaks to their mission and direction.
Right.
Yeah. Now, and the NAACP, you've got to wait till the new leadership is identified. You're saying,
yes,
right?
Yes.
The new elections take place. But.
Yes.
Do you feel like you have a good understanding of what these different stakeholders bring?
Yes.
And what they will be responsible for?
Yes. I didn't check it off on this because I want to bring that copy to.
You want a clean copy?
Yeah, I want to get it. Yeah. And.
Yeah, we talked through it for building the logic model earlier in terms of which partners, what is the value of each partnership in terms from both input as well as output standpoint, and trying to define that a little bit better. So I think we're getting there. And what I'm going to do is based on this conversation and what we've outlined here is try to put together a more visual representation of the logic model for Levada so that she can bring that to have these initial discussions with her, the folks that she thinks need to come to the table.
And I wanted the partnership themselves to be able to say, I could do this for you. I could do that. So it's not me telling them.
This is where I see my fitting in. Yeah.
Yeah.
Yeah, it's way different.
So it's not me telling them I want you to do this, that, and the other. It's what I want to do for you.
Let it be their idea, as Dr. Esterly always said, right?
That's the point.
Right.
You came up with this, but I had it in mind all the time.
And that's really.
It doesn't say that second part.
And that's really that's really the value of having a logic model, because you can lay it in front of them and they can say, oh, I see where I can fit here, and I see what I can bring to the table here. Those are the sorts
People
of things
love to say how they can add value, but less. You always feel a little bit more when somebody's asking you to do something. So I think that tool's good.
And then if there's any gaps, I can always ask, do you think maybe you could help me with this? Yeah, I can help you with that.
You say no to everybody. Yeah.
But the power of talking about that up front, right?
Pardon me?
The power of talking about those things up front.
Up front, oh yeah.
Huge.
This is tremendously helpful.
So that you're not making, assumptions that they're like, oh, I can't do that for you. I never.
Never agreed to that.
Well, how about the community health worker project?
Well, we felt that we needed, Brian, haven't had a chance to talk about this specifically, but the promotores, we definitely wanted Nora's buy-in because she leads that group, and she was, there at the table. And then, of course, in our own department, the health ambassadors, they were on board, and will continue to be on board. Nemours Health and Prevention, Nemours with the asthma workers. The only way they were hedging was a little bit was that their funding is over in June, isn't it?
Right, and that they had a more implicit focus on Sussex County at the time, so there was some leveraging that had to take place there. But I think there's still an interest from their perspective in terms of more longer term goals, because they do have a cost center, a funding stream, so to speak, on these population health efforts, and that's going to be a focus of theirs for a long time. But aside from that, we've got the state Medicaid office, as well as the Delaware Health Center for Health Innovation, or Delaware Health Innovation Center, which is parsing through the state's innovation model that they were recently awarded, and an element of that that is tying both the healthy neighborhoods perspective to the clinical perspective is the coordination of care and the integration of care, of which thanks. Back to you, Bob.
One group we're going to lose, I would suspect we would need to re-engage.
I bet you guys would enjoy a different sound.
Yeah.
Time's up. I didn't know it would play it out loud.
Is we had community members that actually signed a letter that said they'd like to participate. So I'm sure that dropped off their radar screen, and whether we can re-engage those individuals or we go to other individuals, we'll just have to wait and see.
Other issues, comments?
You guys want to say something about the issue you identified or want to work on? 30 seconds.
Well, do we identify issues that we just talked about? Talking with stakeholders, and the fact that we would, of course, have the Helen Graham Cancer Center and the Cancer Support Community. We talked about whether we use downstate treating facilities as well. Mike was interested to find that there were only a small number of oncologists in the state, that we could probably go right to them and actually assess them, and then bring people with cancer to their caregivers. So I think we have the stakeholders down.
And then just that for some groups, it might not be a direct road via cancer. Then so if potentially they're African American.
Some of the underserved communities.
It might be more of a route in terms of health in general versus specifically access things through something that isn't a health center. That might be through a faith community, or it might be through another avenue to get them to the table.
Did I understand that right? What you just said is that some people who may be included might not have the cancer focus. I mean,
well, just to get the good point that got brought up is that sometimes for an African American male with colon cancer, they're not necessarily coming to support groups.
Right.
Yeah.
You might have to go to church.
Yeah. Go to church, or go to a community agency or something.
Heard out. Levatus, your stakeholder.
Yeah.
Absolutely.
Yeah.
It is, I was thinking of some of the different projects, and I think you guys are all there at some point, but there's sort of the collateral engagement of the people that you need sort of to do the functions on your team. There's, shut up, Heather. There's the engagement of the community you want to work with, patients or, communities. I think the one part I forget about the most is, and I joke around, I call it executive engagement. To always remember to include that next level above you. Like, so for instance, do you guys want to be reaching out to somebody at the CDC now to say, this is something that we're working on, to get on their radar, or so that if there's 5 other people who come to them with a similar idea, they can start, making those connections that, so things can be more ubiquitous. I mean, when I think, of yours, I think of the state.
Oh, yeah.
And I think of the big $35 million grant that we just got from the Sims, and to, I mean, I trust Brian's on that. That's kind of, he has his ear towards those things, but, certainly, you want to be thinking about that, not necessarily even sometimes it's playing a huge role in this project, but because of what role they might play down the line. So let's see. All right. And so this we're kind of, so the next thing we talk about is compatible competencies, our skills, abilities, behaviors, and knowledge. Often the academic partner brings certain competencies and the community partner brings another. And some of you, I know, talked about this when it came to leadership. Not all members are going to have the same competency. But the team should think about this and make sure you have everything that you need, and that things are complementary. So we are going to discuss the perceptions of the team members' competence and indicate any areas of discrepancy. So the thing like this for me is often, not often, whatever, but sometimes they'll be like, well, you're the researcher, you've got this. And I'm like, well, I'm not, like...
You're the researcher, too.
Like, you're the researcher, too. Well, and frankly, I'm not a biostatistician. I'm not a data analyst. There's a lot of things that I'm not. And there's a limit to the type of research that I do and have done. And, I'm not a very experienced qualitative researcher. I'm not going to lie to you. I'm not. That's not, my forte. So it's good to kind of put that out there.
Yeah, sometimes you do broad brushstrokes,
yeah. So why don't we, did you work with Levada or Lizzie? Oh, you were, okay, all right, why don't you go there? And I'll come over here and work with,
Two teams.
are you guys kind of doing a?
We're sort of both involved in both.
Okay, that's what.
Brian is more so, but I'm working
And with the chart,
Yes,
exactly.
Yeah, well, I was just thinking about
the areas of
we can
discrepancy.
assign him. He's gonna have to do.
Oh, yeah, we chose 6 or 7 areas that,
Yeah.
NFL Sunday, seeing this stuff in my head.
I was wondering, where did I hear that before?
I think that's what's wrong, right?
It is.
NFL.
The NFL on it was free.
We haven't done that.
Interesting exercise.
Yeah, we have.
And looking at that, as we talked about before, the different partners that I identified would bring the areas of discrepancy would be the ones that
there were 8 of those. Grant funding,
Well, we
so
determined
there was
eight.
actually,
Sometimes it's just a matter of
there are 9 of them.
remembering
Oops,
the
keeps
different
going.
pieces.
Oh,
So this is interesting exercise that
There might be more.
and that was what I was saying, I wanted
you only have 2 people.
the group together
3 people work great well.
to come up with, that was a discussion that we could have to identify what, not just my perception, but the perception of the team.
This is funny, I mean, it's good, personal behaviors, being willing to share power, self-reflective, humble.
But I think that the area where we would have trouble, I think we would work that, on confident. 99% sure that we could manage together, but the question that was raised before about who's gonna be the fiduciary agent.
They might say, maybe not.
I don't know. And I think
Yeah,
that's a joint decision.
yeah. Maybe we should put that on our
I
agenda
think
for.
it's a joint decision.
But you know,
Well,
there's,
we
there's
could do
also.
well, the 3 of us. Well, the 3 of us should do it.
We don't do it,
The 3 of us
yeah.
should do it.
See what you think.
Guiding that joint
And you can
decision,
agree on how many
one of
you
them
want to
being
do.
that
Five
the funding for this grant,
5 and 5, you can do 10. It's up to you.
Yeah, that's a long
as
list.
many grants, like it has to be a registered
Yeah.
agent, right? Like it has to be somebody either a 501c3
I know
or,
there's
so you have to figure out, is there an agency that you work with or that you partner with that is willing
Well,
to
I know
be
those
the
things
point
that are
person?
other,
Yeah.
then we can kind of
They would all
empower
be
each
willing.
other
Uh,
to.
Which one do you trust
Yeah,
the
the
most?
one-
and
yeah.
The most organized?
Frankly, which one would you feel most comfortable being able to say, well, let me look at the, like, give me a report on the spending for this
See the
month or
spend down.
something, you know,
Yeah.
whatever it is, and have them, have you confident that that information is accurate. You know what I mean?
An individual tip.
And that's a
I
tough
think
thing.
I
No, that's a
think
tough
they
thing.
look at that because,
I've been doing the whole,
as I said, maybe,
yeah,
I didn't think of,
yeah, I mean, and that's nice to know, Scott, is
of asking the question of myself
Yeah.
before, because maybe that was something subconscious, I wasn't thinking, ask myself.
Yeah.
But I really need,
no, stop.
I really need to have
I got 20 years into the.
time to
No,
think
that's
about
stuff,
that,
yeah.
because
But that's definitely cool, that stuff.
Yeah, I mean, this is
So, I
something,
mean,
it's
you know, when I look
important,
at
right?
this,
Because,
though,
like,
I am
See,
kinda
at the-
curious, how much, do you
at the
think there's
state
anything
level, I really,
any like little
we just had
quagmires that we
elections,
should be
I
aware of
don't know,
before we go?
I
Is
would
there any-
have trusted the other person.
No, I mean, just
I
in
don't
terms of like
know if
community,
they're
just like, is there any,
in that
anything
position.
where you're like, where we're walking into
And I said,
something
you're
that
gonna
might
have,
be overloaded?
Well, I don't know whether.
everybody's gonna
things
wanna
are
know,
loaded,
well, why
but
did you
certainly
make
walk
me
into
the?
personalities.
Well, you're the lead, right? I mean,
Yeah.
so do
Laura
you,
was mentioned a minute ago.
you associate yourself more closely
Well,
with?
I know our regional network doesn't have a 501.
Okay, so that takes
So
some
that,
out. How about the sorority?
eliminate.
And Nora
They have a
just envisioned
501,
herself
in
as
a
the
ACP
person
have a
ready.
501.
Right.
That's the kind of-
yeah, I mean, those are options, you know,
Keep her in the.
I probably would go with the NAACP because they do have accountability to the national, whereas our sorority,
Right.
She's somebody that would want.
I'm competent
Right.
about the person who does it.
Like the quagmire is how much some of the.
Basically-
But I have,
She's off the wall, that, you know, that we
Yeah.
have to deal with her.
Yeah.
I would
To
just
me,
feel
those are the only
more
Okay.
comfortable,
things that we might talk
more.
about.
Okay, so the
So
team,
there-
what I thought for the team, I think one
Eyes
of
on
the
it
things
every
in our
day.
team
yeah,
is
yeah. I mean,
our lack of
so
knowledge about,
it's what?
and I'm gonna call it
It's 20
assistive
grand.
technology.
Yeah, yeah.
It's 20 million.
I didn't think of it because I'm
Thinking what are the kinds of things, the kinds of
Oh, it will, but this
accommodations
is the
we're going to
thing,
be
you also need to be confident that if there is an agency that you identify as being,
whether it's technology
small
or
contract,
it's agency, what the
and they
range
have
of
the money,
those
they get the
options
money,
are.
and
I
it
think
sits
that's
in
something
the,
that, you know,
Would never
an
personally
account
have to be
somewhere.
handled, which I think is going to be very
That you
critical
can
to
share
our
with their
finance.
financial analyst or whoever.
And then I think
And say,
for the team, I think one of the strengths, I think it's just
every,
really
like on a
our,
monthly basis, this is what I want my
I want
report to look like.
I want to use
My
this as
financial
action.
report.
No man.
Because I think from
And these,
all of
these
us,
are
I
the
think from a
individual,
different
these are the
perspective,
individual
we
elements
feel
of
that there is
financial
somewhat
report
of
that I
an
want. Also, just be
injustice
confident that
in
if
the
you
current
need somebody
policy.
to get reimbursed for something
And
or
that
paid for something,
there's
that they get
a
paid,
strong
and not just that they get paid, period.
Well, yeah, either one of those, I don't worry about that, but I'm just
Yeah.
worried that like a monthly support.
Commitment to the.
Somebody to try to get involved. It is a
I would
population.
think that Excel would make that as simple as possible for 20 grand.
Yeah,
For three
I
of
don't
us.
foresee it, it's not gonna be, it's not gonna be extremely detailed, but also, the bottom line is, you wanna be able to say, this
And
is
they
what,
have really difficult restrictions that they're.
this is, within my budget, this is what, these are the line items that we assign dollar values to, whether it's supplies, training, consult, you know, whatever it might be, and that you're, over time, that you're paying, your payments going out are sort of matching what you think the activity. But that's about it, I mean, other than that, there's not gonna be much reporting on this.
Excel have to create a simple contract with the fiduciary.
Maybe the timeline versus
I think it's gonna be very much into the actual.
And I don't know that that's a compatibility, I think it's compatibility.
That's what I initially
should
Forced us to kind of reflect. bit more before we jump into it, so in a way, that may not really be an issue.
I think it's also, I think that, I like what we're talking about, should we show? I think in the beginning of a project,
you know,
they're easier, I'll tell you, dive in and start doing
space, and I'm wondering.
So I'm with you on that. I'm kind of thinking it's an okay ratio
There might be
right
some
now, but we
associated
need to
charge
transition
somewhere.
into that action plan.
That's one of the reasons why I think
The ones that I chose were all voluntary organizations. I'm just wondering, travel, well, I don't know, whatever thing that we would build in there, that they would ask for in addition, because I think my budget is over.
So down for 2 months, you think about what's the third one? I don't know, 2 weeks.
Something like that, so that was gonna find some money for this.
They didn't say they would give you 25.
Frankly, sometimes.
They said they don't give you 20.
No, I know. It's good kids, I feel.
we tried.
I was counting on, this is what I need to do. Things like that.
And I think,
I
think I'm
the nurses would
depends on
have
what
to
the activity is, but I do think when we're talking about bringing partners in, I think I do have a greater sense of let's do our homework, get it right, so that when we go public with it, because something that's just on my own, I'm often just, let's just jump in and just get started.
I think that's a strategy too, because then you articulate some of those issues before we fall into them. I do that probably. Mother figure that it was like, no, I'm good in one direction. Correct.
Partnership. Participation in the decision. I mean, that's the whole thing, how.
Let's come back together as a group.
Because who wants to be the boss?
So that was the NFL Fox theme, in case anybody was wondering. It used to be the ringtone for my husband. It made me realize it was him calling me and distinguished me in the phone calls. But I don't know, there's probably a lot of sad NFL. Anybody happy right now with the NFL? Anybody still have a team in it that, team in there that they care about?
Seahawks.
I was just sorry to see Oregon lose. Still thinking about that.
Ravens are
Who
gone.
won?
Ohio State.
Oh, they did? Okay.
Yes.
Well, I'm a Buckeye.
Pretty
Get
decidedly.
into that.
I still think one day I'm going to write a little quick handbook, how to talk about sports when you don't know a thing.
Right.
Because I
Sports
think
for
especially women, women would really benefit from it. Random lines you can always use, but boy, they have heart. There's always next year.
Yeah.
All right, so you guys, anything you want to
This is actually really interesting, actually, because we realized that our team is pretty great.
It's pretty great.
Pretty great.
Pretty great.
It's not correct.
Great too. Great. Two out of three. But and again, it comes back to how big should the scope of the project be. We don't have a lot of expertise around the pediatric cancer survivors, which is this whole issue area that are very, very unique needs. And then the other one that's a gray area is around this population of young adult cancer survivors. So this just kind of led us to a conversation about how much of that would we even want to capture with a project like that, with like a project like this. And I think kind of what we talked about is it probably is very important for us to get at those young adults. And so Sean was sharing some people that might be able to help us do that. But the pediatric piece, because we don't have that confidence, we really might just need to leave that on the table for this one.
Yeah, absolutely.
Yeah, I mean, I think the scoping is key. and sometimes as important as who you include is it's as important who you exclude. And I think you can save yourself a lot of trouble if at least you're doing it and you know why.
Yeah.
You know what I mean? Like, so you know, for instance, would be less likely to piss off the advocates for pediatric cancer if you knew, you know, look, we just don't have the expertise.
Right.
Yeah.
We have, you know, reasonable expectation that that population is really going to look different than the adult population.
Yeah.
It's on our radar,
Yeah.
but we just don't think we can do it justice on a project of this scale. And I think then,
I'm
you know,
writing it. Slow down.
There you go.
Yeah. Sorry, yeah, I mean, that's.
Yeah, I mean, those are the kinds of, you know, and you know, sometimes, you know, in those circumstances even, I mean, believe me, look, if, you know, I'm no polished politician. If I have any wisdom, it's because of stupid things I've done. Sometimes to reach out in advance to say, look, I don't think we can include you on this, but here's why, you know, is a far better thing than having people hear.
Yeah, that is going on around them, they don't know about it.
So we just proactively tell them that we're excluding them? I mean, yeah, I mean, maybe, right?
Maybe.
And that's it. I'll echo that. Having done a lot of this work over the past 10 years or so in terms of building partnerships and coalitions and stuff like that, that's a very important factor.
Yeah.
And early on saying, look, given the scope of what we're trying to focus on and the amount of resources that we have, the partners that we're going to include are X, Y, and Z. And we know that you are very interested in this field, but you have a focus explicitly on pediatrics, and we're just not quite there yet. But maybe when we look for more funding to expand the scope of this, you're going to be the first one we call. You know what I mean? That sort of thing.
Yeah, that's great. That's great.
And particularly in a place like Delaware, you know, that's vastly important because the person that finds out about your initiative or your project before it's widely known is going to call that person anyway and say, hey, did you hear about this? Were you included in it? Before you get a chance to do so. You know what I mean? So.
All right. Anything else anybody wants to? All right, the next one's pretty straightforward. You have to have adequate resources. So now we're really moving into, you know, think about what you would put on the budget. You know, so do you have space? Do you have the equipment? Do you have the right people? Are you sure that you are going to get those people's time as you need it? And obviously, the finances. And, you know, like many a project, you know, there's the ideal that you might do as a first step to get towards your end goal, right? However, you shape that first step based on sometimes what you've got. And in this case, I'm sure that all of you could have come up with a $100,000 project, but it was a $20,000 RFA. So you know what I mean? You kind of you target for that. But even sometimes when you target for those, you find out that you know you have to revamp, that you sort of missed that mark. You didn't take about that. So we're going to take a few minutes and talk about what resources did you identify through working through those pages in the book, and pages 49 through 52. And then we're going to come back to the questions 1 and 2 on page 51 and talk about this. Sound good?
That's good. Yeah.
Well, one of the things following ours is that
we put in for a grad student,
maybe IT
and then so
resources, like
he or she
programs could be delivered in Spanish.
she'll.
Yeah, I know that's a huge.
I know it
Right.
She will.
So I was just thinking of
Right.
Those
So
play
for
out
all the-
eventually.
Yeah.
Those choose
I think
requirements, and we're
It's
not
a
talking
thing,
about
Right.
like transparent.
Right. And if it can be, if we can figure out areas where
That's
it's
around
within our budget.
On her part. So she'll do that, and part of
related to that.
We had interpreter money, but not money to transfer materials.
So maybe not in the key formulas, but definitely should be very involved in we've got our.
You know, it might, and that's just the question we're asking. Put it out there. Yeah, exactly.
Well, we're talking two different things. One, translating the Excel course into Spanish.
I did think that's what you were saying.
Well, we were going to provide interpreters in class for preparing
Actual
but for sustainability to translate the course.
Yeah, no, and we did, we talked about that a little bit about whether or not that was, you know, a step that we want to be, so, what would be your maximum, and maybe it is now, especially now that, A, we're not guaranteed funding, right? So if we're seeking funding elsewhere, do we want to be able to say,
what about
from a training perspective, that if the resources and the, videos and all that stuff are translated, can we effectively incorporate Spanish-speaking patients and family members, or you know, promotors in that model?
Kent County.
Kent County would be too.
Panel will meet monthly in the first quarter of the project to establish study protocols and work plans. Beginning in the second quarter, the advisory panel will make bi-monthly or as needed at key decisions.
Okay. I mean, we do, I think, there's really built in a little bit of breathing room around all this really.
So maybe February, March, April,
for whatever reason,
June.
some bit more, there's probably enough
I think we have to better understand from our
July, September,
I mean, even
November.
that mix in terms of patient and family members that the promoters work with, you know,
What's the schedule again?
and would we need to cover that full spectrum, or could we focus
Then the only other practical thing is, you know, they are in Sussex. I mean, how good, lack of better words, the course going to be watching it remotely versus participating.
Right.
Yeah.
Yeah, because we figured out early on, that given in absence of upfront funding, that would cover travel costs, it's just not feasible.
Right, and we did travel, we have money in here for travel, we have money for printing interviewer guides.
We had some, we would have some community health workers, but then
we have money for interpreters as well if needed.
We had two community health workers who agreed as well.
So I think space-wise,
so they would have to either remotely dial in. We were assuming that they had the capability to do so, maybe they don't have a computer at home, you know, so that doesn't mean that we
And then just a little bit on the software side. IT is all really one of the UD stuff is all good. So that's something that our because of their to it. So I've been but I mean, we didn't do that. But assessment, yeah.
We're not aware of.
On the fund side, we built in
How
for
about you and your, what resources needs were identified?
So what pivotal
It was really the curriculum, the CDC curriculum for body and soul, to get those materials out there. It was
so that would include focus groups.
travel expenses for the nurses to do the curriculum. For either the church or
guess my
civic
question is,
association, or if there was a nurse.
I mean, one of the goals is to increase participation without jeopardizing the integrity of the survey, and I think CDC would argue that moving the survey from paper and pencil to an electronic version might jeopardize the integrity.
Types of budgetary things that I consider.
Are they doing
phenomenal.
it anywhere electronically?
How about like healthy food with their
That's a good question,
demonstrations?
I thought we could.
I know it's something
That's
that's
where
been
we would
talked about.
get Hill to come in and bring some of their resources.
Others.
And maybe, the other thing was, the Zumba classes, you know,
Yeah, just.
for the instructor.
Also, you will need.
That was it. Mostly it was written materials and supplies. We don't have papers.
Well, it's probably
I think we're at need right
devices.
now.
Projector.
I remember the
Congregation is have something on
everybody
available.
was computer-based
I should
thing.
have brought.
Like, there was a week where every class took a turn going to the,
I don't know.
like, the little auditorium room. Well, 'cause it was, they
But
did
down the road, I mean, this covered.
But, I really kept it simple.
So they somehow got all these
As I
people that
said,
they set up in like the,
our volunteers, so the
auditorium.
biggest thing would be
so they
the
had
travel
all
expenses to get
laptops.
the nurses
So
there.
they just bring classes.
There's another one, travel.
I mean, we
Is the
probably want to
curriculum
operate too.
have a
It's
minor
only
cost?
one, they have the whole, and they got the whole school.
So,
But that logistically, that.
It didn't before because we could get it free, but you know, that's small cost, so I'm
We
sure
actually have free access
they
to
were
it.
charged for
Well,
it.
they
All of it. Which is like surveillance you need before they.
Well, that's what I keep thinking about the
So
birth
for the
is where
online,
we
it's
did
the other
the,
piece.
I think it's free, but I think
the
there might be
traditional
costs for
telephone
some of the, at least when I was working with
Started
them,
talking, I had mine.
and then
helping
a
to
parallel
put some of the
with
curriculum
cell
together.
phone sample.
The cost was more
And then
associated
you
with
look
actually
at-
assembling, you know, getting the
Right.
binders to be able to put that free information.
Are they equivalent?
Make sure that it's usable and not too
My colleagues don't always tell me what
big
happened.
and bulky for people not to carry.
But they've
the class
actually
and that sort of
also
thing.
piled
Yeah.
the class.
as a.
We were doing,
Yeah.
The birth is,
we were doing the,
Fred
6
was
weeks.
kind of funny. He kind of stuck that in basic conversation. We were talking
And I don't
about.
remember,
Yeah.
are we measuring the outcomes of the participants of the classes, or are we measuring how effort, ability to
how
carry
did they
it on?
do that? Or just
We were,
send a
we
link?
were looking to see if there would be a behavior change, parents getting,
Within the participants.
yeah,
Okay.
get the childhood, the children to choose healthy selections and parents to do the shopping. That there would be a change in their behavior.
Supermarket tours, part
Yeah,
of
see,
that,
this is
or
the
not?
problem, you have that whole system.
It was,
It's landline.
part of that,
Years,
again,
decades,
from the
it's
Healthy
phone.
Kids initiative was to,
And it's fall, the
see
sampling frame is
if
fall
there was, grocery stores, the corner of the grocery stores, because in the urban area, a lot of, food is
They don't know the number or now.
not healthy. Provide, yeah. Looking to see if there's a change in what the meals that the parents would prepare and offer the kids at home on a daily basis, and if the kids would choose a healthy snack rather than chips and
Yeah, this is a different project, but, not this past ACEA, but the one in Boston, I saw a great presentation of a group that worked with several and they weren't really targeting the parents, because right, this group in their Parkerstown, it was like an older sibling that was in charge of what was gonna be.
Well, they never did that, they always have
Because the
someone.
parents were still working, or were retired cook, or whatever, so they worked with that, or said, they got the 7-Eleven to offer, different healthy choices and all that kind of stuff. I don't know, it was interesting. Could track it down.
What was that? You said Boston?
I think it was in the Boston area. I mean, that's where the conference was, and I even think the project
For
was
you,
there
in
too.
your mind,
But anyway.
Sounds like camp
in terms of what's gonna be different, what's gonna be CSD,
There's, I mean, the other thing too, I mean, there's
the survey definitely gives us like a lot of information about different sort of bargaining in terms of,
So I think.
but then the interventions piece, I mean, that's all.
you know, I mean,
Yeah.
I think what Liz's question goes back to is based on the resources that you want to put towards the assessment of your efforts.
Yeah.
Are you focused more on assessing the function of the partner?
She's retired.
That's secondary, or are you supported
She works at
Brian's had a lot of experience that with all
she worked
hands
at
moving down forward, moving women forward, moving people as it worked over the years.
The Office of Women's Health.
Just a 1 year thing.
No, I mean, yeah, and this is, and we've always been.
And that might actually be good.
Faith-based institutions. Really.
The last, she worked for us on
It was for years.
It was actually fun. It was fully funded.
she'd been retired.
Which is pretty remarkable in this day and age. I think for a whole 12 years.
Also, this is part of
In 3-year increments. In some iterations, it was. It started off with the August and it started off with focus on women, and then it moved to pregnant women and their young children, and then it moved to a focus on men and women, and then
have our hand in
it's,
All right, so here, rather than come back for a group discussion, I think we've plowed through a good part of this, and I feel like everybody's getting something out of it, or at least getting, where they want to go next. So I think what we're going to do now, we're going to take 5 minutes, everybody get up, energize, get a drink of water, go to the bathroom, whatever, and then we're going to switch to the part that Dr. Khan will lead the operations, team operations. So, sound good?
Yeah.
Right. Jumping jacks in the hall, yoga next door.
I'm just going to call it.
I think that might be important.
Anybody need some coffee from the shop?
Okay.
Does anybody need coffee from downstairs?
No, I'm good, I'm good.
So you're,
If I can get through the morning, I'm
so
good.
you're still for this DC meeting?
Yeah, the one I sent you. Yeah,
Well, you know what I'm not going to submit to that. I'm going to.
Okay, that's fine. Mike's grand plan in his
We gotta
email
get some
seemed to be,
churches,
so you submit the ACE Award and I submit the CEO
and all
framework.
your peeps come to dance your
If,
heart out.
would you
all
like
the
to
time,
just
yeah,
co-author
we
on
love
the
it.
CEO
That's coming up.
component and give input into that, and that way
Well, let me make
you're
this
co-submitting for
one
that,
I
as opposed to if
haven't
you're
done
not,
already.
especially if you're not working on ACE Awards, you just want to work on that together.
Sure.
Last this long, because I didn't take my water bill
Mike needs,
this morning.
I know.
I'm too busy.
And in our meeting, of course, one of the big things was, no, you need to be able to tell me when I know that. I keep saying that.
Yes.
I say no, and you say, great, so you do this. And I was joking with him, he's like, oh, that's funny, I do that. Oh, I'm like, yeah, you do, not funny.
Yeah, except you're the only one laughing here.
Exactly. I think he did exactly the same thing, and I suggested to him yesterday when we talked, he said, so you guys are doing that thing. I said, there's no you guys, you told me I'm doing the CEO piece. You told me that you would like Heather to do the ACE Award. You said that in your email. If she hasn't said yes, I think you should think that's no. Like, no, I think that's probably me. I think she's going to do that. Okay, Mike.
What did you talk to, by the way?
Hmm?
When was this
Yesterday
conversation?
morning in the hallway somewhere.
Oh, interesting, because
Yesterday,
it was
yeah.
Monday that I feel like
Yeah, I think it was yesterday. Yeah, yesterday.
Oh, interesting. Right, Tuesday. Yeah, it was Monday that
Okay, good.
I pretty clearly told him. No, but not good, because Tuesday he thought he didn't get it. Monday I was crystal clear. I was like, I'm going to pass on that.
Okay.
I have too much to do. I don't know what
Good.
else.
Maybe you think about the NAPCR one instead, or whatever. And
Yeah,
I just have to be
I am gonna
incredibly
try these.
clear. That's why in my email I was like, here's what I will do, here's what I will not do.
Right.
Everybody.
Everybody.
Yeah. Leads to mutual, sort of disappointment. I think if someone like, hey, I'll definitely do this. Like, no.
Right.
That's good. So I'll send you the abstract for the CEO one. As far as we've gotten, we essentially have an entire CEO component who agreed or wanted to be co-authors. So I was pretty sure if you want to be co-author, you also have to give input to the abstract. So everybody has, I think, been interested in doing that so far. But Friday's kind of the deadline for doing that, unfortunately. So.
That's good to know. All right.
But I've already put together a framework, so
Okay.
I think it'll be okay. 2,000 characters is the limit, which is very weird. I've never really submitted to a contest with a character limit before. That includes author names and affiliations. So it's a very weird. I think these guys have never run a contest before. I don't know what this means. Abstracts are word limits, and the authors, etc., are separate from that.
Yeah, because like you're punished if you have a long name.
I know. Are they running out of like, digital data? What's the problem?
Yeah.
So 2,000 characters.
All right. I'll come up with a good nickname.
Yeah, I know. HBF.
It's just that. That's all I need.
Yeah, exactly.
Well, I mean, I haven't looked at it yet, but I imagine, for the CEO, you're just going to talk about like how to reform the CAC,
Exactly.
Watch and Learns,
Yep.
the ACE Awards, sort of the mechanisms that we use.
That's exactly it.
Okay.
Incorporating CEO into a CTR, basically.
Yeah, kind of the idea that, we first went this way, but now we have to figure out how to diffuse across our own. Yep.
Oh, and there may not be money for anybody to attend. So, I had to say that in my request as well, saying, please contribute, but you may not have money to go. It's expensive. It's like $700 to register.
I take it you're going to South Carolina, by the way.
Yes.
Did you book your stuff yet?
Yes, because I have to go to ADFM first. So I'll go to ADFM, which is in Savannah, and then drive from there on Wednesday night to South Carolina, stay there all day Thursday, drive back to Savannah for my flight back. So I'm flying out from BWI to Savannah. Okay. Kathy and Mike are doing the same thing, but then they just have to either drive or fly or whatever.
Okay. AD is directors?
Departments, Association of Departments of Foundry Medicine.
Okay.
It's more sort of administrative, but looks interesting. Challenges facing departments and so forth.
Yeah.
What are departments? Will they exist? What to do when your CEO existing departments are dead? Like in our case.
They have a breakout.
Yeah, exactly.
Yeah.
No, there is one about how to adapt departments in a world of circuit science.
Ah, there you go. Well,
It's very important. It's exactly what's in front of us right now.
Yeah. At least it's timely.
Yeah.
Our colleagues are across the hall debating very important things.
I can't go over there. I'm afraid I won't come back. And I'll probably get something else to do.
Oh, that may have happened anyway.
Well, yeah, actually, you're probably right. I should probably go there so I don't get anything else to do.
Brian, you got to take a look at the clinical translational science research abstract at some point, see what you think.
Yeah.
I'm going to try to get it in by this weekend.
Okay. Yeah, I'll take a look at it tonight.
And everyone said that they want to focus this with.
Oh, good. Good. Yeah.
I mean, I wish, had I had better. But anyway, I did badly on my first try. So I went ahead and paid all that
No,
money.
actually, we're just putting us. That's a.
Had I been more savvy.
So in
Like
March,
somebody just said,
you got your, this is a collective project.
And
We're having our 5th annual cancer card out and Chase Center for
equity.
It'd be nice to invite your community.
And the notion that
So,
identify
spent a
the
year
imbalances.
Thursday, March,
Being
and
able to be
then
honest
this
about it, and then you work your best to make
It's
sure
free.
that there's equity
And if you give me your email, I'll
distribution.
I'll
somewhere in
send
that
you
time course,
the email invite and
I buckle down.
if I need to promote it. We're this year, we really are trying to extend it more to people with all
Yeah, it was
levels
the
of
PhD camp.
ability, Mobility, I guess I should say.
So
disability.
Yeah, I mean, by
So-
that point, you know, I
One of
was
the
in mixed class.
That's one of the feedback last
We
year.
gotta do, we gotta do it.
There was too many people sitting because the level of exercise was just too rigorous throughout the night. So we're gonna try to have somebody keep maybe even sitting, somebody medium, and somebody high, so people can follow. And see if we can pull it off. Yeah.
Well, I can find out what the website is.
Yes, actually, you can even go now to christianandcare.org/lectures.
Okay.
Go to March 19th and, yeah, it'll be there. But within a week, I hope we'll have a kind of attractive HTML email that I can send you and you can forward it to your membership or whomever.
Yeah.
That's great.
Something like that. This is about 40 credits, right? So I took about 20. And then that sat on the back burner for
What is it? Oh my goodness.
probably for like 5 years. And then
It's a nice
I got my
mission
career development
statement.
award, and I had written in there to take the time to finish that.
So I thought it was a good meeting
when I
today.
got my career development award, which was this
Yes,
year,
I thought it was. I'm really glad we got
Stacy.
because I think otherwise, honestly,
And what else?
No, we could have kept staying stuck.
like a project.
on one hand, really glad and people respect it, because that's how people perceive it.
It just was,
On the other hand, having
the
that
things I was
person try
supposed
to
to
move
accomplish
things
were,
forward,
Right.
conduct
I mean, the question
analysis
is,
of the National Health
let's see
Index
how
survey.
far we are in
Looking
our
at
Let's see how close second is. I want to say, are you?
I'm almost like, are you serious?
racial, racial.
It was almost like,
How much,
how much you made it.
your job, how,
What was that one about the number of people being low or something?
dissemination
Remember
of your parents of
It's just like,
Makes no
the
sense.
worst. Yeah, but how much are we the worst?
Yeah, right, yeah, does that matter?
Yeah.
But you know, I think when you had
Yeah.
the
But I don't think it is.
were you there when she said, she made a great suggestion about, can we call it young adult, so you don't get the knee-jerk reaction?
I wasn't, I don't disagree, that's a good idea. Young adults is only challenging because it's still adult, so 18 to 25 will have lessons is correct. Even 16 you may just squeeze it. It doesn't capture the 15 to 14. So it's technically
We're getting present.
exactly.
Yeah.
I'm just glad that the rest of us
So a lot of that
uniformly strong
Other side.
You know,
Yeah. It's like she represented the opposition.
It's great. It's good to have the perspective, but some people want to have this power.
I
What else
know.
I mean, I will be just make it male people. I will only have to.
Right.
That's the letter needs to go down. We would like them to be male people. Reproductive health in our young adults and adolescents.
Right, yeah.
I just don't know how to get out from under the burden of women who are in their 30s and 40s.
Brian, were you here
Who
when
they
this
could have
was done?
impacted when they were 15 and 16.
Never know.
Talking
That'll
about
always
these
be,
sort of
right? I mean,
diagrams.
there should be fewer of them if we.
That's what I'm saying. It's hard to say.
Yeah, that was really a wise strategic move.
And the set of
I mean, I'm glad
skills.
I mean, she's a good partner.
Because you use that at all?
Wants to be, she told me personally many times, you find education.
A lot of times we get books and we just sit on the shelf, but
Just don't let.
I don't let it go.
It means you know what I mean, like, you know, the ideal person has,
There's some.
Right, and then, you know, as it starts to get elevated, she's, why did she might as well know sooner than later, you know?
So I will go on. But I think she'll also help them directing us a little bit.
Yes.
I wish in terms of, we need to make sure candidates are not just maybe signing off on it.
Fully supportive of it.
And I
Yeah.
think that's a good idea. We should just put a memo together and say, we would like your approval to bring the presence candidate as these senior level officers.
Or, and then for AOP consideration, that's good.
Exactly. I think that sometimes get more accomplished in that.
Smaller, oh, we do, I was on
Our
crazy.
group is good for sharing information, but this group is better for getting stuff done. I don't think large group would be like always a 60 group to share information, not to try to make decisions. This is probably a better decision making.
Definitely. One of the things I worry about with the adolescent groups, and now
It's not funny, but
we have
it is funny.
clearly defined at least, you know, say 3 aims within a deliverable, more detailed plan, you nearly can't get that done in a meeting.
Good point.
It's just
We need some working group, some meeting on this. Music is always okay to. No, not yet. Sorry, we have to.
I know they were running for coffee.
Yeah, they were running for coffee.
It's gonna take them a while. Alban is a little bit slow.
Oh, that's right. If you want to get them coffee from
I don't know when Alban Pond is going to get together, but I still feel like when I go up to the counter, they're like, yeah,
You want
a latte. Oh, okay.
It
depends on the people, but
it's.
Are they just new at food service?
They're still deer in the headlights, huh?
Yeah, they still are very,
maybe not learning the menu
Okay.
might be something.
But coffee is always on the menu.
Right.
I have no idea any types of coffee. Like Heather asked me to get her something, I said, now do they know what that is? Because I have absolutely no idea.
Perhaps Scott's getting double mochaccino with caramel and
No, I'm serious. I ordered a latte. Just a latte, not a caramel latte, not a skinny latte, not a latte with an extra shot.
Straight up latte.
Just a latte. And I got like this look, and then this was a little bit more towards me. And there were 3 people
working on it,
converging around the making of my
latte. Wikipedia.
Exactly. You're going in.
Google image.
That's funny.
That's because they make so many different types of coffee.
They have a focus for their anger.
Different ways you can make it nowadays. It's not simple.
Although Dunkin' has, they have probably the best coffee process model in the world. So I don't Google cost because like 13,000 types of coffee combinations in the world. I totally believe it.
I believe it.
And they turn it out. It's amazing.
You got it down. Whereas Alban Pond, they don't have it down yet.
Because they probably specialize in sandwiches and the cooking.
The best thing about like Dunkin' Donuts is that given our tendencies to pretty much go to the same one over and over again, is they get you right away.
They do.
They know, and you get that boom. Like the minute you walk in the door,
totally
it's coming out.
Yeah, exactly.
That's really that's pretty phenomenal. Given
You
the amount of foot traffic.
Yeah,
like the amount of foot traffic that comes.
Do you know how that goes?
Crazy.
True.
Well, I used to work at an ice cream shop at Bushler's, and we used to have our regulars.
Okay.
It's easy to remember faces, especially if you're nice.
I got you.
Especially if you're nice. There you go. There's your tip. That's always the case.
They're about my
Or if you're
voice.
really mean, you're
They don't have
Yeah, I'm like, nope, I don't want to.
Yeah, right, you wait.
You're messing us up, guys.
What time are we meeting?
10 on Friday.
10 o'clock. I was here at 9.
I know, I'm sorry, you called me. And I was down,
I said, well,
I had to watch about 9. Very cool.
My dad actually
I went over there to the annex. There was one over there. I called Jerry.
Did you have Jeff Baxter also? You want that? Right?
That's not what I really because
we invited him. My dad just simply because he Thanksgiving with us 2 years in a row.
Right. What were you going to meet with him on?
Yep, Dr. Mayor, City Council President.
All right, folks, welcome back from caffeination and walking around, jumping jacks and so forth. So we're going to talk a little bit about the partnership operations end of things. So before you all go to sleep, so I'm not going to read from the slides here. Anyone who's worked in an organization really knows much of this. This is really intended to be fodder for the discussion. So this is not going to be a lot of didactic stuff here, but basically the operations are what are the processes associated with your partnership. So how will you work in your partnership? How will you use some of these tools to help you get these things done? So for example, a typical defined structure. All of you, many of you, most of you, work in an organization which have leadership and some documented processes. Well, that's simple enough. So the key indicators of operation. What what does this mean in your organizational setting? How much might you bring this to your teamwork? So transparent communication and structures. Is your understanding of your structure and leadership the same as your teammates? Is probably the simplest way of looking at it. That to me is transparency. When people definitions converge, that's transparency. Conflict resolution, Heather talked about this a little while earlier. First, you got to make sure you have created conflict, and then figure out how to be able to resolve that conflict. Sometimes shying away from conflict is an interesting form of conflict resolution, but not the most productive for a team. I could actually have some of that first. The original slide said acknowledgement of power and equality. And in my undergraduate training, my learning about political science and political theory, we were taught that there's never such a thing as power equality in teams. And as you're working your teams and your larger coalitions, so think about that. Think about what kind of power inequalities exist in your teams and in your larger coalitions that you actually may have limited power to completely address. So we all come into the world with power inequalities embedded in our society, whether that be because of our gender or our race or our social standing or our employment or our place of residence or how many kids we have or what religion we hold. I mean, all of these fall into that. So we might never address it, but we have to acknowledge that these things exist and then work towards an equitable framework. But equality is perhaps not the perfect word to use there. I think equity is one that most of us tend to prefer. This gets into some of the communications preferences and methods, and it's interesting, even in the same group, which may look very similar, people have very different ways of communicating. In our group, say in our department, people have very different ways of wanting to talk about things. If you send a note out by email and say, you know what, maybe we can just get this done by email. I have a colleague who actually doesn't like doing that. He says, let's meet about this. And somebody who just thinks, well, that's an email question, can we not do this over email? That's an immediate conflict. So you've got to then come to some agreement on that and say, what can we do reasonably, in which forum and which medium, for which person and for which group? So as you all communicate, think about this. Email's pretty common, but sometimes picking up the phone is pretty good too. And I find that in complicated situations, it's easier for me to pick up the phone and say, can we just talk about this? Face-to-face tends to be pretty good too. And Facebook, the other face, is an interesting way of communicating. You can use the messaging framework. You can use Twitter feeds to communicate to a broad audience, but usually not in a one-to-one setting. By mail is interesting. So if you're communicating with people in 1875, yes, I think it's a great way to. I'm just kidding. I think paper is still okay, but probably not within your teams. I don't see you using this a whole lot. The point is, acknowledge what communication styles work for you. You might even consider an exercise. And I like these sort of mini anonymized exercises where the team members each write down something and write down your preferred communication style and write down what you think the other person's preferred communication style is. Let's say in a group of 3, you can do that. That's pretty easy. And then share your results and say, wow, you really think I prefer the phone? I thought I was such a techie. I like to do email. The other person like, no, you sort of suck at email. I can never understand what you say. That's okay. So these discussions are important to surface. But what you got to do is think about how to, you've got to come to some agreement on how we're going to resolve these types of issues. So the what, how, when part is important. When are we going to communicate to whom? This becomes really essential when you're talking to the outside universe. You got to think about what messages are being put out there. Now, for you, those of you who are in 1 or 2 person teams might be easier. Those who have 5 person teams and who have much wider coalitions, what's the message? Who's on point on this? Who's doing this? How does it get back to the larger group? Might seem simple, but you got to be attentive to this ahead of time, I think, to make it really work. We already talked about this. I'm going to jump over this in terms of structure. Think about what you need, and this sort of echoes the theme which Heather's emphasized over the last hour or so, in terms of what do you need to make this happen? What are your strengths, and what might be some areas of weakness or opportunity that you want to strengthen? So do you need more people involved for guidance and direction? Do you have too many people for guidance and direction? How are decisions being made? You tend to talk about it and say, you know what, we'll just kind of wing it, we'll come up with something everyone likes. That's sort of the Quaker model of, sense of meeting as opposed to saying, we'll make a decision on this. Are you going to vote? well, in a group of 3, that means 33% will always be unhappy. Then think about that. So as long as you're conscious about it, I think you'll make great decisions. But you just have to be attentive to summarize power dynamics, communications issues, and transparency. Those are sort of my 3 takeaways from this set. So what we're going to do is we'll do the same format of the exercise, and this is page 56 through 59 is the exercise, and then we'll get into the discussion after that. This is the discussion question posed to us. What did you learn, and what are the next steps for the partnership to put agreed upon communication plans and structures into place? So let me rephrase this a little bit. First of all, what are your communication plans and structure? Do you have one? Is it informal? Is it formal? And then how are you actually operationalizing it or putting it into place? So maybe think about 2 or 3 of those things. So power dynamics, how have you identified those? Communication plans, how do you intend to implement those? And structurally, are there steps that you're taking to make that more of a conscious effort as opposed to just letting it happen? So let's noodle on that for about 10 minutes, and then we'll come back and check. Yeah. I think I will rotate.
My initial face, and then I was just.
Carrier pigeon. Obviously. I guess too, that, I mean, like, it's us really solidifying this dog's role, and then, so if you're saying the one that really does sort of solidify their role, like, is the style,
The one that we use for
I don't know, maybe better for others, I don't know how the sort of the person works of the award works, there's really a discussion around it, so.
When we meet, if we're going to do these weekly meetings,
just the link for the most part. And so,
And then,
Versus
you know,
they're
that's part of
they're all
what we're
committed
talking
to
about.
things.
So a lot of this sort of
smartphone,
broader work is really the purpose of
whatever.
the study.
Here's
So
our couple
those
things
are
about
all
the way
kind
And like
I
action.
feel like it's
involved in some way. I mean, they
So,
go
I
from
mean,
like
the other
from
thing is
personal
that
relationships to yours,
here's
to
the frustrating
them being involved in a study.
you gonna start on time, you organize, you're gonna end on time, and those are things that slide a lot of times.
Yeah.
And we can,
Just one of my
I
pet
can add
peeves,
you
you know,
to that.
face to face is usually more productive unless you have somebody that unfailingly comes in 20 minutes late or 20, 30, you know.
Yeah.
All right, you know, so, and that's a minor, that's also conflict with resolution
Yeah.
there.
Or, you know,
So
right.
that's why it really takes a good facilitator.
Email.
If you are
Because I think
somebody
Yeah.
particular, hopefully it's the person that calls right that.
I mean, my only job is to take minutes.
Exactly.
But I'm really bad at participating in the conversation.
Yeah.
I mean, I get that.
Interesting, we have one right now, it's a person that I'm pretty close to, really sort of works for us in a way, through what we want. But she was just saying, she was so frustrated by the way that most of the communication I sort of are part of the conversation, because I'm still writing. But, probably I kind of scribble. So I've got to
Yeah.
write quickly and send email. I don't like you to do it, you gotta go back and, you know, create what it was that we talked about. But,
I don't
and that
want
happens with
email,
communication
yeah,
sometimes.
I don't want emails, I just hate to reply to all.
Oh,
Yeah,
that,
see, this is this is what we're, well,
I know, that's actually another thing that can really sink your group in a way. It's a minor delegation happens,
Yeah.
you have it there, yeah.
I mean, you said it, you have reached your really
Well, what do you think about the power dynamic? I did like what Tom had got it down here. Here's power dynamic. You always have to host the meeting, so you don't have to go anywhere, you walk down the hall, versus somebody has to spend half an hour getting there, parking it into your 8th floor building. You know what I mean?
I think we should,
That's
that's
not
not
a
an
power
hour,
dynamic.
I think we need to
For
talk about.
Scott, it's a huge power.
Yeah.
For us,
The go to them thing
She
is,
can be.
I mean,
piece,
I
and
didn't see
then
that
once,
as
and then they have their own kind of.
power thing.
No, not to see it as a problem for our group.
Yeah.
Just,
Well, she, I just know this month.
Yeah.
January is winter session at the university, and I know she's
that's part of your MO.
session.
Where were you
like a
planning
whole
to
semester.
Well,
So I know
I was
she's
hoping
teaching every morning.
because of the distance. to have-
Usually I did a regular Thursday, she teaches.
Yeah, I know. Now that I know that.
But for winter
that's all-
session.
That's all we need.
That's very
I just had to figure out longer session. The IC, which is not.
To be honest with you, the easiest way to do this is just say, send an email either to me or to Passerella and say, or on these days at these times, we want to have these meetings. And then all that's required is, from my perspective, my understanding is to accept that and set that meeting time.
And it reminds me, I have another project that I'm.
It's basically just a web link, right? And so you would send it out to your partners, and it would have the information. They can either dial in by phone and not be seen, or if they have a camera, whether it's on their smartphone, their iPad, or their computer, their laptop, or whatever, they can dial in. And, you know what I mean? It's pretty straightforward. It's very similar to the script, but it's
Fortunately, my office mate is
So I think we
similar, so we're just sort of decisions like in a dinky way to your desk. Understandable way. So in theory, I would be doing this differently, where you're on the board, you know,
Some people say that.
you know, all of seeing all that. So these are different.
Now, often our talk about, I think, the decision-making process or conflict resolution.
And without formal governance, you know, it's
a little
difficult because people are looking at you as sort of the person convening as the leader, and then you're also being sensitive about other people's ability to actually carry out tasks given their volunteer nature, right? So you don't want to be like out assigning people things to do. So it's a negotiation. Usually the way that I've gotten around that is to make sure that the structure is not necessarily around the task assignment, but around the agenda setting. So that if you go in with an agenda that says, you know, A, B, C, and then there's subpart 1, 2, and 3, whatever, with the things that you hope to get out of each bird's discussion, then you can just say, who's interested in taking ownership of this or something.
Yeah, and I also like, you know, I think it's sort of weird in a way to sit down with the coalition and decide how you're going to decision-make conflict resolution. For me, a lot of times it's setting the expectation, and a lot of times the logic model, the plan sets the expectation. Conflict can arise, but as long as people are pretty clear that we're not, you know, we're not curing COVID obesity, or, you know what I mean, or
there may be a place for us
sort of,
to,
you know what I really love is
set up a web page.
article you gave me a number of years ago on collective impact. You know,
So I mean, that is a really good story in terms of what being really
knowledge
and
about
every of us is with the.
I mean, so that might be.
Because I'm really would like to see each partner as equal partners.
Well, you know, I mean, I have some of my planning groups.
What you're doing with this.
A lot of time it's shared credit.
One place you can go
successful.
and look at the material.
Who's gonna
download.
share the credit among our partners? Yes. But if you have somebody that's somebody in authority or in leadership that's constantly talking about the great work that Lorraine did versus the great work we all did.
Well, the only thing is, I know I have to check with our ACP international folks. But I know at our local level, the president always talks about,
Well, we could probably.
because I'm really talking about partnerships.
I guess it's another
And
versus the right communication.
that's good, but we
The
want
timing of
To get
yeah.
I've actually, I'm on the board of the ARC, and I was trying to start this coalition with them, and they're like, we want the ARC to be out front on this. This is our statement.
I mean, I think.
Why can't we just all get along?
Well, you know, it's about recognition, really.
I understand that, but here's my question to you. Are you more concerned about your recognition or reducing your child's obesity?
Or our goal. Your recognition or our goal.
Yeah, so what's your answer?
Good.
You know, and if, you know, we're all in, and this is what we work, we're in this together.
Right.
So.
Right, so.
No, I think okay. I just want to.
So maybe we need to just think about the people we invite, what are the, you know, what.
And people will come to your organization because you've been
Maybe we should
involved.
resign.
I'm sorry, I don't have a fancy alarm.
You know, but you should sing.
I should, yes. No, I should not.
But sometimes people are struggling for recognition and there's a way.
I know that. I know that. That's why I said one of the secondary goals of this topic is that we've done this
Make it work
together.
Yeah.
All right, folks, we're back. I forgot to set a fancy alarm, and I don't think I have one, so this will have to do so. There you go. So we thought we'd follow the same format as before in terms of us just having some general thought on these questions and what next steps might you take to put these agreed upon communication plans into place. So would you all like to start us off?
Sure. Well, we were talking about both our team communication and our communication with our community partners, and we were talking about different methods, and we actually decided that for our team, in terms of sharing documents and things, one of the things that we've talked about doing, but we decided, Liz and I, that we'll do this today, is we can set up a site on the university, like a Sakai site, so that we have a shared space where we can, you know, put our notes and documents, and I find that helpful to have one common place for that stuff.
So whether one uses Blackboard, Sakai, SharePoint, some common place of electronic repository, which is more of an internal site really at this point for yourselves.
Right, so that's really just for the team, and then we were talking about, I think we're starting to make a list for our agenda for our first advisory panel meeting, but that's one of the things, is sort of preferred method of communication. Would a website work, or does email work, or what, you know? So we don't completely know the answer to that yet, but that's a question for the group.
Sure. A question for your advisory group, not this group.
Right, yeah, for the advisory.
Good. Other thoughts on communication plans?
Well, I was really excited to find out that I could use blue jeans.
There you go. Is that going to be how you want to start with some of the communication?
Well, no, the first is going to be face-to-face. Have already happened to some extent. But beyond that, to settle up, to use Doodle.com for the best meeting, find out when all of us are most available, and then utilize blue jeans.
Sure. You know, we had an interesting problem with reaching out to some Christiana Care colleagues a while back, even with using email, which I think would be pretty simple, right? Well, it turns out that once you become affiliated with the hospital, they give you this sort of dummy email account, right? And they assume that you read this email account. And so a bunch of researchers who I've talked to trying to reach community physicians and other communities who don't have their full-time place of work right in Christiana, they're like, how come this con guy, he never responds to his email? Well, because the con guy doesn't have a Christiana, doesn't actually check his Christiana email. His preferred method is a different type of email in the way we're trying to reach them. So it's interesting the nuances of even getting to it's as detailed as making sure you actually have the right phone number and the right email and all those things. So never take anything for granted.
I have to share this.
Yes.
I actually, it was probably 4 or 5 weeks, maybe that I get back a message for the CTR saying all these people didn't, they didn't pick up your message.
Oh yeah.
And what we have is an encryption system, and it reads my messages, and if it thinks it's a patient-related matter, it encrypts it. And they have to go log on and put, information in to unlock the encryption and read what I wrote. Right. But it didn't tell, I don't know whether or not that happens. which is just fascinating. I was like, you know what I mean? So like 3-4 weeks later, you know, I get back and there's like this list of people in the community that, you know, probably, they were like, thanks for including me, Heather. Thanks for keeping me up to date. How come everybody else knew? And I'm like I didn't. See the date?
Because all the recipients got from Heather at that point was a message from info@zixcorp.com, which said, you have a message, you have a privileged message from Dr. Heather Binder-Fagan. Please go to this website and use a secure password which is 900 characters long, and please pick up your message. And this person like, this is spam.
Absolutely.
Right.
Yeah.
Right.
So unfortunately,
and they even go to their spam folder for all you know.
A lot of people have that. So there's ways around that, but if we don't know it, we can't solve it. So that's the kind of things to be attentive to.
Levaden mentioned an annoying email practice of replying to all.
Yeah.
You know, or people on your group.
Can you come help us solve that problem?
Delete.
Yeah.
Well, it depends. Sometimes if you're working on something
No,
and it's a
right.
small group, then that's the appropriate way to do it.
Right.
But
No, inappropriate
But
applies.
it only applies to that person who asked the question.
Yeah.
Do you want to meet me later? Yes. But I don't need to know that. Get a whole group. Get a whole group show up.
My favorite is I've seen people reply all, and then somebody reply all to them. So don't reply all. Yeah. I swear to God. And I'm like, this is funny.
I see that.
So it's a wonderful catch-22. Sometimes, you know, the onus of communication is it's really two-way. So, for example, if a message isn't intended to reply to all, the fastest way of getting rid of that problem is do a blind copy. So it's actually not possible to reply to all. Or embed in your message your expectation. I would like you to directly reply to me, please. Or please feel free to reply to all if you feel like you need to share your opinion. And if you set up that expectation as a communicator or a principal investigator, then your recipients are much more clear about what does guy really want me to do.
Okay.
And they don't feel bad about hitting reply all button.
Okay.
You know? So that's kind of a way to think about that two-way piece.
Yeah, you know, the other thing that you made me think about with the big address list when you have 50 names or something is
Do blind copy. Yeah.
Well, to do blind copy, particularly when you're using community members, because you may have people's personal emails.
Right.
And so not only do you have to not scroll through the pages and pages of email addresses on these lists, but you're protecting people's.
That's a good thought. Yeah, absolutely. Did you guys have something that you'd like to add to the conversation about your plan for communications or about the power dynamics piece, whichever one? What do you think?
I think we give ourselves titles so that
Power.
Yeah, that's right. Yeah. No, I mean it was
King, viceroy.
Right. We all get to meet. We all get to meet.
Exalted ruler.
Yeah.
Like that.
We all get to meet king. So just really kind of what our competencies are. Really looking at it, just making sure they're. Just as I'm looking and listening, really tightening up what our kind of internal communication is and what those meetings are going to look like. Mm-hmm. And then I guess the other big piece is, especially potentially for Sean, the messaging to the community and if he ends up being sort of that liaison, how does it get liaised back and how do we consistently message? And if it's becoming burdensome, how does that sort of get passed off in a way that I mean, honestly, that I'm sharing that load in a way that's meaningful. Yeah.
I think you actually highlighted two really important pieces: transparency and assigning of roles. So transparently assigning roles to each other, which are explicitly agreed upon by the other team members. Here's what I'm going to be doing. Here's what you're going to be doing. Here's how we'll be working together. Here's how I will help you do what you're doing, so it doesn't become burdensome for you.
Yeah.
So that's exactly the kind of conversation. Think about though how often we work in groups where we don't have this conversation. We actually don't say, this is what I think your role is. What do you think? Other person like, that's not all what I think. It's really important to have those honest.
Why can't we get this thing moving?
Yeah, exactly.
Yeah.
I thought you had this. You know?
Yeah.
So having those authentic, open conversations is really critical in the first piece. So,
the other thing we talked about was it relates to communication and power dynamics and potentially conflict. It's like, if you set it up where people always have to come to you, all you have to do is walk down the hall, right? And they have to drive and park and go up to the 8th floor, whatever, I mean, and so that's sort of a power thing in a sense. It's something that the group should decide how we're gonna, who's gonna host and what it's gonna look like, that kind of thing.
Yeah, my office is always open, but you can never find it.
Yeah,
Absolutely. You need 5 passwords, a badge, and everything else to get to it. All right.
That particular thing also comes up a lot if you're doing statewide meetings.
Oh, yeah, especially in Delaware.
One state,
You gotta go to
Dover.
Sure, we'll go to Dover, but no one will show up.
It's funny how the sorts of things, when the governor calls, people do show up in Dover. I mean, the
All
power.
of a sudden, it's not a problem.
It's not a problem, exactly. The power dynamic kind of thing. So thinking about decision making, you guys have started this conversation about how decisions will be made. And I think you got to some of this, but let's get a little more granular and explicit about how decisions will be made. Now that we've talked about power dynamics and communication, how do we think, what are these processes for how will something be made? Let's just assume something comes up that you didn't account for, that you could not completely predict. I think something like that is probably going to go on. What's going to happen to that information? So it flows in, and then you all say, okay, well, here's something come up, here's a decision needs to be made. Is one way to deal with that have explicit roles so that okay, well, this is a community decision, let's let X take the lead on this. This is a funding decision, we already decided. So the funding czar, they can take the lead on this. That's one way to do it. But there are other ways to do that as well. So let's take a couple minutes to think about the page 62, 61 for the material, and 62, 63 for the group discussion. And there may be a question lurking in here as well. Again, this is not really a question, it's more of a sentence.
Yeah.
That's okay. So the sentence in this case is more of a guiding theme, if you will, a Zen koan. Equitable distribution of the work is essential to avoiding conflict and ensuring mutual ownership of the processes by all team members. Discuss. No. But we are supposed to think about this a little bit. How would you actually put this in place? This is a great thought. But I think the question really is, what would you like to do explicitly to make this actually happen? I know you already got to this a little bit, so we won't take a whole 10 minutes. Just maybe take a couple minutes to noodle on this, and we'll come back to this.
Can I make an assumption?
Please.
That being that you're the grant, you got the grant, and you're the lead of the coalition and the money. You got to assume that the burden of a fair amount of work is going to be on you versus the group. Now, if you don't distribute the work, it's all not going to get done. But I think as the lead, you assume that.
To state back like you're doing, so that do you agree?
Does everybody else agree on that? Yeah. Do you make that assumption?
Right. I did. Was that incorrect?
No, not for me. That seems exactly right.
Well, is Excel going to create a simple contract with the awardees, which will say when the reports are due, and you know what I mean? So
that seems like a you question in terms of the actual contractual aspect of this. So
that's what typically happens.
Typically, when an award is given out, there is an actual
simple
contract, which is more the legal piece, which says we're giving you the money, spend it well. Yes. But then there's more spelled out requirements, which are see attachment A.
Yeah, for all your work.
We would like you to give a report to us, ABC. You as the principal investigator are responsible.
The other piece that
you could have a
not
second investigator who does some work on that.
We are going to have a
ultimate responsibility.
So there will be a fourth member.
Okay.
Yeah.
The way that we hope this will work, and I don't know about the way that we hope this will work is that the onus will be two partners. You know what I mean? Well, as a team, see themselves as the co-leaders of this project.
Okay.
So I would say kind of both responsible. Now, for practical purposes, we require that at least one of those partners be one of the CTR institutions.
But I'm thinking,
so that's where the money is going to sit. That's where the cost center will have to sit.
problem.
The CTR is not,
Maybe
you
something-
know,
I'm not gonna have somebody else.
I would be shocked, fall on the floor shocked if they would, you know, let the whole
We are, we're gonna
community,
Well,
be like,
I mean, I
okay,
think
here's
a
your chunk of
different
money,
that
community
might be
partners.
helpful.
So
But
let's
maybe
go
it's just
to-
like,
Yeah.
you
So
know,
it's
easier
Brian,
to follow the
community
elements.
partner.
Yeah, I knew that, but I didn't.
We were trying to figure out what the other partner is gonna get the money, and you're saying it has to be a CTR.
Right,
One of
that's
the-
all.
Yeah.
But I mean, nobody has that, you know.
So I think of the deliverable piece, you have to decide with Brian if you,
Right.
like who's gonna do what, and then with.
Right, that's what we
Well,
said.
I would assume that because it's community driven, that would be me.
No, I mean, I think,
And
especially,
money,
I guess
financial, and
my
that kind of
concern is.
Yes and no,
stuff would be.
because there are all these other things
Your time is
that he brings, Excel brings to the table.
Everybody's
So
gonna
you're
be
saying
involved.
that I'm gonna
So
rely
for
on
me,
you
it's
as a
just
partner for all
the-
these things, and
I
you don't
just
have the
get
expertise.
you're a young man of money.
Stuff that'll.
Oh, the money stuff,
Yeah,
yes.
that's all I'm worried
The
about.
first
All right,
couple
cool.
probably
That's all,
deal with
that's all I'm concerned.
But, I mean, I don't
wanna
want
touch that.
Right,
So we'll
but
have
your
to
other
figure
concern
out
is data
what
analysis,
works,
right, which you
what's
don't
gonna
think
be
you
the
have.
procedure
Yeah, but I don't.
for that.
Yeah, that was Excel.
But I think.
Excel and,
Looking into-
public stuff where they
Yeah.
had, remember?
Oh, okay, so
Robert
we're
Morgan.
okay.
Yeah.
We have a
Robert
part,
Morgan
another part-time
and,
person who's working with us in the past.
Yeah.
This is where the, partners are going to
Right,
contribute.
right.
Yeah, this is where that comes in, this division of labor, okay, who's gonna do what?
Yeah, we got
Okay,
that.
doesn't always have to
I
follow.
was just worried about the money.
Yeah.
Alright. And what, I
Yeah.
mean, I don't know if it's written out, if it's gonna be written out anywhere in contract, but I can tell you that the things that the CTR will look for in terms of deliverables, in terms of saying this was successful, they are hoping for, you know, any of the following, the more the merrier. A publication, a presentation, a submission for other funding. Those are the kinds of things they're gonna really make.
That's a measure of
And
success.
that's gonna be their measure of success.
In that order, a publication.
Yeah. Yeah, no.
Maybe not the other way,
I have-
if you were to present somewhere in an abstract, if you were to get this, you know, published,
Published, and then
the third
or-
C,
and
an application to a grant.
But I didn't.
Okay.
More money.
Yeah, and the fourth would be,
Right.
and then no one's gonna be there for
So
it.
just that we have to take.
Publish.
The things that would make the CTR feel like they got their
Okay, I have to
investment,
write
right,
down.
the money in these teams,
Who
would be,
you talked
you know,
about
one or more of these are
teenagers.
presentation.
Who am I putting down
On the work,
this item, you know?
at a
and sort of back up
Yeah, I
this
mean, and
drive
that's-
regional, national, international,
And that's the thing,
you know,
so
better
for
is
you,
bigger. So presentation,
your-
publication,
You and Scott's
with publication
schedule
in
is
a
gonna
peer
have
reviewed
more
journal,
of that.
being, you know, preferred.
I mean, I'm not saying mine will
And
go
then
there,
the sort of
but in
higher,
terms of like
these are probably
permanent
levels.
time for research,
Application for another grant.
Right, right.
It's literally.
Something that makes them very happy,
But I'm
using
noticing
this data as a
It's
pilot.
not.
And again, you know,
primary
to
work.
state,
So
regional,
in that
you know,
sense,
great,
we do
the bigger up you go, you know, if you find that, you know, put that on a federal level grant.
Did you make a decision about it?
And then obviously the holy
Yeah.
grail of all of
And
this,
if you ask them.
acquisition.
Exactly.
But you're
So,
gonna do it.
you know, so
You
you
know,
really
having-
should.
But no, but I, you know, I
So
said
that
as a whole
learning
ground,
about
no
just the
one
process
thinks that's
of
gonna happen
the
Or-
as
Here's
your
the
next step.
decision
And then if it's a question of world
Everyone
order,
kind of realizes,
then
you know,
like,
something,
that
you know.
I-
Kids just learn.
Okay, well, yeah. Or
For
It's more support.
the, publication and
Yeah, well, it's
presentation
all
now.
good. And then
I
you
would
have
want
to
to
guide
do,
for
Well, worst case, right, like, yeah.
Right.
and
Like
then
action
it's
items.
for us to-
and we do
All I
have
know with
our story
everything I've ever done with
in
research
some
is it
journals.
always,
So,
it always takes longer than it was supposed to.
the application to, for another grant, if we didn't go that far,
Go right, and it just,
this isn't
it
considered
always sticks
successful.
sooner than you thought it should be.
It's not, it's not that they expect everything.
Main two things is what I'm interested in.
Those first two things.
Yeah, publication and presentation.
But how are you gonna sustain the effort? You know, that's
But
one.
worst kicked you in the head, what would be the
Got more
simple
money.
or idea that
Bigger
would
money.
that, you know, and do that? Because you can read.
Well, I was thinking that the partnerships that were
Add layers,
developed
but
would
to
continue.
I find that's harder.
You know, most of, all the things that I'm involved in are volunteer
It's
things.
not a life, it's a.
You know, except for the materials and
been doing that. I think
Like, let's
now
put this way,
we're
from
stepping
that
in
piece,
here.
That's not a whole lot
that
to do.
first
Right?
day,
If you're really interested in doing something, you'll do it anyway.
So when we were doing the IRB,
So, I mean, I had anticipated going on beyond publication and showing whether it was viable or not. So, if somebody else wants to do that, that would be fine with me. If someone else wanted to continue.
Maybe when we're talking about, the workload, there would be one or two people identified who would be those.
Yeah, like Christiana cared to
grant writer.
Until we know.
I mean, I think that's, Ryan's not here, but he's your academic investigator partner, right? So that's one of those things you want to talk about up front, like, look, I don't
I'm not
plan.
interested in that third.
I don't plan on writing.
Which is, if he's the other partner, he could take the ball and run with it.
Right. But you could present it at one of your national conferences and or
Absolutely. And that's what and I'm in it, just for my own personal satisfaction of having done some research. And I'm perfectly satisfied after that.
Keeping each other accountable.
Well, and we have all sorts of teams, right? But usually in the academic end, you've got to pursue funding or die.
Sure,
you know what I mean? So less
she
work
was
here
going
when
to
you're
research airfares or a trip,
or when you have a CTR. But for the most part, if this is purely academic, they give you about this much time before they're like, oh, that's nice, you want to do research, how you paying for that?
But it's interesting, like on our side of community health, family student medicine, that we're always thinking our expectation is, largely grant, whereas the next one, if we're gonna stay afloat, we're gonna keep our jobs, it's like you gotta keep going.
And as I learned over time, working with funding goes away, so is the
For the first little bit, then yeah, I can do whatever.
This is, there's so many
kind of the way that they've
other
got it set up right now.
levels that can continue beyond the churches. If they're successful doing something, they're gonna keep on doing it.
And that's your key, prove it works.
You get this sort of sense of get it done, but it's
It keeps on going because that's the right thing.
when the bulk of that work happens, we've got some flexibility to do that.
But anyway, if Christiana wants to take the ball and run with it, I'll be all right with that.
I think for this level of project, when you talk about work distribution, it's not realistic, but like when you're on boards, it's usually the subcommittees that, you're in charge of this part of
This
your
drives
that's
one
why-
way. This is
Brian and I will
it?
have
Is
to
it
discuss.
This is a good one. I really,
Some people love the operational stuff, some people like.
I didn't like it, but it was because it's tough questions.
Force the ones to make.
Yeah, this was tough.
All right, folks. So we're ready to
Plan with the end in mind.
come back to the main group here. So, so it turns out that sentence I put up earlier that actually wasn't just sitting in isolation. This piece here, the equitable distribution of the work, actually was a question which I didn't actually see. But here was the question: how will your team make decisions? That is workload distribution, which I think is basically what we said. What the decision-making process. And I sort of eavesdropped on a couple of conversations, and there were some good ideas as to how those decisions are going to be made, structurally speaking. So, does somebody want to start us off with some ideas they came up with for their groups, for their teams?
Sure.
Yeah, go ahead.
We'll start. I'm going to do whatever Mike tells me to do.
There you go.
No.
Top-down hierarchy.
Yeah. That was supposed to be implied. No, I mean, I think it's the other way. No, I mean, it's an interesting thing. I mean, the reality is that for me, in terms of my job at the university, research is 40% of what I do. So in terms of that workload, and then as part of our budget, we've hired a graduate assistant to work as a research coordinator. So in terms of having sort of some of the means, in terms of my time and and a student that can do the work, it should be that more is falling to us. And then there's some things that you know, in terms of the introductions and stuff, that Sean is uniquely able to, and Scott as well, that are uniquely able to do and need to be part of. And then the decisions, and then the other thing we're talking about is there's sort of those type of decisions in terms of the bulk of the work, but then the other decisions are the ones around when does this work happen. And I think that's still really evolving. And the one thing, yeah.
So how does that decision get made then in terms of when does something get done, and where does the locus of responsibility lie with those decisions?
Right.
Because there's three of you folks, and you might just throw it out there, but have you thought about what your particular areas are of direction where certain decisions that flow into your team, they sort of go to each somebody, or is somebody first going to take the first crack at it as a PI and then sort of, you know, send that out to everybody else?
I guess that's how I've been thinking about it, but maybe that's naive. You know,
just what works for your team, as long as you're thoughtful about it.
Yeah.
But maybe a different process. Well, let's do a couple of other ideas, see if we can help you think about this a little bit more as well. So, you guys want to share some innovations that you came up with?
I guess our decision process, we pretty much agreed, is very collaborative as a group. We have three in our core team, and you know, I think as we sort of define this process of communication and moving along, I think one of the points that you brought up is kind of holding each other accountable, and it's easier to do in a small group, but as you get to a larger group, you need to kind of define it and, you know, keep notes and minutes and things like that, and use that as a tool to kind of make sure that everything's kind of staying on track and moving forward. So I don't know if I answered your question.
Well, you did. You actually gave a great example to me when we were talking. I wonder if you might mind sharing that idea about how you use your minutes.
Oh, well, I was sharing, I have a youth group, you know, that my daughter's involved in, that I've been kind of, you know, supporting, and they're planning a trip, a summer trip, and so I've been taking minutes for the meetings, and they kind of think I'm annoying sometimes, because I will force them to say, you know, I need to write down
who's in charge of that.
Who said? I know you talked about sort of planning the Valentine's babysitting, but who's sending the announcements out? You know, so just sort of that tool of forcing the decision
who's responsible.
I have to write it down. You know, sort of that record forces the decision, but then using the minutes in terms of putting in an action item, so everybody's clear that, you know, Liz said she was going to send the announcement out by such and such a date. So
and you got to get them out right away, you know, because it's people, when they look at those action things, they think, "Oh, all right, I said I'd do that, and I got 3 weeks now."
Right. Well, that's what Omar said. He wants to see that, so he knows he's got to do it before somebody comes looking for it.
Yes.
You know, but that active minute taking, that's an incredibly good management tool, which many people don't use very well, because we sometimes use minutes as simply a record. It's almost like you hit record on our discussion. That's minutes. And think about who in our large meetings is assigned to take minutes. Frequently, it's a junior person who is frequently not empowered, there's the power word again, not empowered to say, oh, I'm sorry, department director, you just said you were going to do this, so tell me again, when are you doing that? So it needs to be somebody who is in a position of sufficient authority to be able to ask a follow-up question, to use the minutes as a management tool, as opposed to simply a recording tool. Now, maybe you simply need to record. Well, great. I would suggest you don't need minutes. You need a tape recorder. But if you're using a human being, you know, with a brain to record something, well, you could maybe go to the next step, which is what you're doing, using it as a decision-forcing tool. So
and I've had to improve on that, because if you send the minutes out, you know, monthly meetings 2 days before the next meeting, and it had all these action steps on it, you know, then typically they didn't get done, or you get a little bit of a panicked call or email from somebody saying, oh, can you not put that on the agenda? You know, I mean, but if it goes out right after the meeting, it's your note, you're putting them on notice, kind of, you know. Right. It's good.
Yeah, sure. I mean, I love when minutes come out with the agenda for the meeting the next morning.
Yeah.
Everyone have a look at the minutes.
Sometimes,
that's life, but.
Even a week is better.
Yeah, even a week is better.
That's sometimes the ideal, because it's too long between.
Exactly. Livia, did you and Liz have any thoughts you wanted to share about decision-making processes?
We got clarity on the budget.
Okay, good.
Yeah, we did get clarity on it. I think, as I stated before, we are looking, since this is community-driven, that for the most part, the community part would be up to my direction. Mm-hmm. And from my co-investigator's standpoint, he would be responsible for the money, but also to decide whether or not we're going to take this further than what my expectations are.
Mm-hmm. So that's good. I think I heard a couple of things in there, which is sort of shared decision making, but allocating what decision goes where, mm-hmm. and having that be mutually acceptable. So saying to the other person, I'm expecting you to do this, I'm expecting myself to do this, is that your understanding? Mm-hmm. And if the answer is yes, you've already gotten a lot further than most teams have. Mm-hmm. So that's terrific. So we're going to keep chugging along here. For the next one, we actually might do things a little bit differently. I'm going to follow Heather's lead on this in terms of maybe have a group discussion on this rather than having yet another breakout time and coming back together. Maybe we'll discuss it and we'll try to get you guys out right on time, if not a little before, because I know Heather would like a few minutes to discuss your sum up as well before you leave. So this is the power distribution piece, which we talked about a little bit. So again, I changed the word equal to equitable ownership. I would agree that I would argue that it's almost never completely equal, and that might be okay given our power dynamics. But we have to strive to make sure we're hearing everybody's voice, and that what we've done is actually agreed upon by everyone, and we get as close to equity as is possible, recognizing the ideal equality is probably unattainable in the short term at least. This should result, I again changed this a little bit. The initial sentence was, this results in an equal distribution of power. I don't think it does. Should it? Yes. Should we work towards that equal distribution? Yes. Everyone should have an equitable say in what happens. Everyone should have an equal share when it's mutually been decided. But to get to that equality is going to be incredibly difficult in a diverse group of people. And that's something that's larger than us. That's societal. But we've got to work on this, right? So these discussions, how do we do this? What are we doing? Mutual expectations. That'll get us towards equity here. So there'll be many items that are bought, collected, or designed, all the products of your partnership, the intellectual products, the physical products. So if you buy a laptop, if you generate a paper, if you generate a patentable idea, what happens to that? What happens to the jointly owned products? Are they jointly owned? Mike comes up with something, well, maybe he came up with a unique idea. Is that jointly owned? If Liz came up with a paper idea, is she first author on this? Or is her boss the first author? What does that mean? Got to think about these things ahead of time. I want to emphasize a couple things here which I think may be useful to focus on. Stuff and papers. So not to make it too diffuse, stuff, laptops. You buy a laptop. Discuss ahead of time. Whenever you buy something, discuss what's going to happen to it. Who keeps it? What happened to it after the project? Who gets to use it? Who owns it? Explicit discussion. One type of product. Second, intellectual product. Paper. Decide ahead of time. Will this probably result in publishable work? Hopefully, yes. Who will get to take the lead on that publishable work? And if you say, I don't know, depends on how we do the paper writing, fine. Decide, though, how you're going to decide. Decide on the framework you might use. When I start working with a group, I send them around the COPE guidelines on publication ethics. Heather and I have tools that we can send you, 1 or 2 pages, on deciding authorship. And you can use those and actually assign numbers to each part of authorship. Intellectual contribution, gathering data, overall guidance, doing the references. And you give yourself a number score. And at the end of it, you add it up, and if I get 20, and if you get 30, well, guess what? You get to be first author. I didn't think so at the beginning. It was my idea. But you did more work, maybe. So use that as a tool.
So in the research world, how, it's like super great to be first author, right? Like, what does it mean if you're fourth? I don't know.
It's a great question, and we actually have had some spirited discussions around this. because I think the most common thing that you will find documented is that you should order the authors according to their contribution, so that that last author is truly the person who did the least work.
Of the paper or the project? Because I've been glad to be on as the last one on there, and I've looked at it like, well, you know what, I didn't really write that much, but the project I did a lot. I didn't even think of it that way, so I just don't know how it's evaluated, you know?
My thought is simple, paper.
It's the paper.
It's the paper. If we start thinking about project too much, I'll give you an example. If we have a public domain data project out there, let's just say we all collect a whole bunch of data but it's public domain. Well, we did all the work for the project, right? Okay, well, what if somebody from the University of South Carolina comes along and says, I'd like to research this public domain data. I'd like to publish it. No, you haven't published it. I want to publish it. Are they obligated to include us? No, they're not. So if you think about it that way, well, we put a lot of work into it, but we weren't authors. Right. So the same way, the paper is the paper.
You got to write it up, man. That's
paper is the paper. I think, in my view, you should independently look at the paper as a product and say who has put in what level of work here. And guess what? If you've been an incredible project manager, well, then maybe you'll be a great paper leader too.
I mean, just coming up with the research proposal and that is already part, I imagine, of a paper that would come out of it, right?
Yeah, if you come up with a research proposal, what you're really proposing at that point is just the research part of it. You may never write it up as a principal investigator. You may just do the research and that would be it. I would hope not, but you certainly don't have to write it up. So let's just say you think, let's write up this work. This is great work, we did this, but I'm going to just offload the paper to somebody else. That's the older way of doing it, where the principal investigator of the research says, you know what, we need these 5 papers written. You, 5 graduate students, write these papers up, send them to me, I'm going to be senior author. Yeah. I'll be the last author. In basic sciences, that's still sometimes done. Here's the issue. When you put in your references for papers, many journals will only allow the first 4 or 5 authors as references. So you can be senior author all you want on a 20-author paper, your name's never going to show up. So you've got to think about that too. So that's why I like the simple hierarchy of most contribution first,
on the
contribution last. My personal preference, I will say that that's not everybody's preference. Some people like the senior author. My point is, think about these things ahead of time. We're happy to share with you tools if you anticipate publishing.
So for someone like Liz who may do, be an integral piece in the programming piece, what section of the paper would you suggest she contribute most to if it's something you're interested in being published?
I would say any section which she's comfortable with. So from conception to writing to data collection to references to submission to serving as the corresponding author, any of those steps or many of those steps are perfectly appropriate. Usually the person who runs the program usually conceives of the paper as well, but not always. So the conception piece, she'd get like a 5 out of 5 on, absolutely. The writing piece may be a 2 out of 5 if she offloads that to a junior person to kind of do some of the writing around that. That's fine.
It'd be really great if you could share that resource that
Yeah, I've never seen that.
Because if someone contributed just the concept of the idea and then the other person did the design, the methodology, all that kind of stuff.
Right.
And coordinated the thing. And did the results and the evaluation. What order would they be in?
It's a good question. I think that's, if you sit with a group, it has to be something both people or everyone agrees on. So you just sit with a group and lay it out exactly as you did. So one person conceived the idea, but this other person actually wrote, executed, data collected, referenced, and found out which journal to submit to. Let's see who's actually going to be first author. Right? I would argue if you separate them into categories, assign numbers from what you're saying, it's not that the person who did most of the work is going to be the first author. That's what it appears to be. Conception alone doesn't get you, in my book, as many points. It's a good idea, so you get maybe 5 out of 5 for idea.
Okay.
But there are other categories.
I think in many settings, though, there's a power dynamic
Of course.
that comes into play
Sure.
here, because I know many graduate students who would argue. I mean, I think this goes back to your traditional
approach to this, but we just had a discussion around, it was not a peer-reviewed journal, but it was a substantial report that was generated, and there was a lot of discussion about how far down the chain would the authorship go.
Sure. Yeah.
And I would have loved to have had that tool, because I think there was some
more objective.
Yeah, some folks were kind of willing to just
whatever,
cut off the grad students,
Yeah.
and I was like, ooh, these
Guys
folks did a
work
lot of
hard.
work
Sure.
compared to some of the other people on this list
Or up the chain.
who were up the chain.
Sometimes-
Exactly.
Sometimes
Anybody read a JAMA or a Lancet article in which case the study group people, all 80 strong authors are listed at the end, right? I'm not saying all 80 people did not contribute a great deal to that paper. I just know that I physically could not imagine how they did that. But hey, that's their way of doing things. Fair enough. But it happens. Still happens. But the point is, I think we have to have the discussions with the authors and say what's fair, what's equitable, and let's acknowledge the power dynamics here. And sometimes the power dynamics are such that we cannot even acknowledge the power dynamics. Right?
Yeah,
So
exactly.
that's challenging.
As far as items, I think I remember when we gave out the cameras to the kids in Photo Voice, it was within their consent that they had to return them at the end, and we had serial numbers attached to their name, and that they. I think we even said they would get their stipend until the camera was returned.
That's good accountability.
All that.
But then what happens to the cameras? I think that's the other question, is what happens to that stuff?
They're owned by our department. Yeah.
And they're in a closet somewhere.
Yeah, they are. But we use them for other things. But yeah.
Liz sold them on eBay.
Yeah.
So this is just what
As long as you turn around and put it to the money to good use, and not,
Yeah, exactly. So this is a key piece. So for all partnerships, regardless of who actually writes the paper, the findings of the project, which aren't necessarily a scientific paper, they're simply the report and findings, they have to go out to the multiple audiences that you've worked with. Partner organizations, stakeholders, the leadership, literature, the broader community, and think about it as, this is great, because when you put out a report, you can have acknowledgments galore.
Yeah.
Even in a scientific paper, if you want to acknowledge people, not them being authors, you know what? Be generous with the acknowledgments. I love acknowledging people. My mentors, people who advise me on the paper but who aren't co-authors, that's great. I think we should be doing that a lot more. So this dissemination piece is a great example to acknowledge who you worked with, and also to put out the great work you did as a group and say, this is what we did. We're actually going to jump straight now to the question, and then I think that's the last one. So we can we've been chatting about this a little bit. The question is something that ensure equal power, I would say that's not going to happen. What will you do to minimize power imbalances? Is probably a better way to say it. And open to your ideas and thoughts.
Is this a big group discussion?
No, in a big group discussion, just right now, off the cuff, as we've been talking about this. What might you all do in your teams and in your projects to minimize the imbalances that especially come when you come wearing an academic hat and you go into a community? How's that going to work?
You go to them, I think. I mean, I think you really take into account who's hosting the meeting. Like if you're having a dinner, party, you take on all the responsibility. You have to do all the work. You're inviting people into your house. The onus is on you, right? But when you're having a community coalition meeting, the person who makes more effort is the one that goes to the site, right? I mean, the host site kind of has it easier in a sense. It's at their home.
We're just here.
Yeah, and there's a power dynamic just in terms of place, I think.
I think going back to communication is key, because if you think about, back in high school when you had to do group work, where there's always that one person who doesn't do anything, and then there's that one person, me, who takes over all the responsibility because, you don't want anything to fall through the cracks.
But you're here now.
Yeah. You have to, communication and accountability and, just really open conversation with each other about, okay, I'm realizing that I'm taking on more of the project than I realized. How can we work together to fix this issue?
Work plans and timelines help with that, with designated people who's going to do what.
True. That helps ensure equitable distribution of workload.
Yeah. And I certainly like that tool in the book, Be Ready, where each one will take responsibility for a certain area. So let's look at this and see if we're kind of balanced. I know that some of the heavy lifting will fall on me at the front end, but after that, we're sharing this, right?
That's a great way to actually just say it out loud, because you have to be explicit, right, with your partner saying, I think you're doing awful lot of this, which is fine, but I'm hoping and expecting the next step is going to have you do more of this piece. That's okay. These open conversations can be challenging, but they're important to have.
But I think one of the things that Kristen, raised is you have to have partners who all have a common goal. If you have someone in your class who they don't care if they get an A, and they're your lab partner, that conversation might not go so well. And I think that's why with community partners, you really need to find people who have those common goals, who really share and buy in, because otherwise they're not willing to step up to do the work.
And they're just going to be,
You have to build in feedback, would be the thing that I would say about
true.
this.
Yeah.
Because in any group situation, you will get the person who is loudest and most opinionated. And
coloring maybe how it's all.
Yeah, coloring and directing. And if you or somebody doesn't sort of either have an anonymous, another feedback mechanism, or just at the end of the meeting, since we've got about 10 minutes left, there's a couple people we haven't heard from. Do you have anything to add?
Yeah.
Do you think we're,
we're on track?
Who's concerned we're off track? That.
Yeah. That is that called a Delta process?
Delphi?
Delphi. You know who's big on that is Nemours.
Uh-huh.
Have you ever been in one, in their meeting? They'll actually hand around it's basically how the meeting go.
Sure.
I mean, they're talking about immediate feedback. They're big on that.
Yeah, the Delphi process is a very interesting way to come to consensus, and it basically is a concentric narrowing of the circles until you have 6 ideas and you shrink to 5, then 4, then 3. It's almost like having multiple elections and come to runoffs eventually, and then you hit your 2 or 3 targeted. So it's a very interesting way of getting to consensus. We could certainly be more conscious, I think, in how we do things, Christiana, with that. Because Heather's right. Sometimes just, who speaks loudest, and the facilitation, if it's not strong facilitation, and this is, I think, for you all to think about your teams, really think about being strong facilitators and getting the voices we don't have a chance as much to emerge somehow in the way that they're most comfortable, and that's challenging.
I can even say, you look like you're just about to say something. Sometimes really, but it's because this one won't stop. I don't mean you guys over here.
I'm taking these notes down.
Yeah.
That look on your face said you didn't quite agree with me.
Yeah,
exactly. Because this is, you can quote me on this, I don't care. Because sometimes the amount of talking and the loudness of someone talking is inversely proportional to the quality of their contributions.
Right.
It's not always.
But I was also thinking, in terms of power dynamics, something on our project, I think we have it totally sorted out. This is going to be one big group, and we expect to have one big group, but we're also going to be doing some focus groups and things like that. So at what point to involve people, and certainly with focus groups, it's one way of getting that voice heard in a situation that sort of equalizes the power within that group. So that's one option of getting that information.
And something else I've always learned in focus groups, you can even tell the person who's talking the most, we've heard a lot, in a nice way, we've heard a lot from you today. Is there anybody else who would like to contribute to the conversation? And that's perfectly fine. Maybe harder in that moment to say is, shut up. But
Or you set it up and you just say at the beginning of the focus group, I'm going to have a series of questions, and I'd like to make sure that we hear from everybody because we want to hear the different perspectives, and we'll go around and.
Are you going to have a trained facilitator, or?
I don't.
We haven't gotten there yet.
Yeah, we haven't gotten there. I think.
That's a good thought in terms of being explicit about expectations up front. So speaking of not talking more, I'm actually going to stop now, and thank you for your great ideas and your insights. This is clearly not a shy group, And so this is terrific. Heather's going to wrap up in chapter 6.
So you guys did a lot of hard work today, but I think it will pay off in buckets. Surely, I hope that your teams will continue on this, and there are some summary exercises to take what you did today and pull it all together. My only summary brilliance here would be, this is really about how do you create a good team and facilitate good teamwork, which in the end can all be distilled down to relationship management. And it's one of those things that sounds so easy, but anybody, and I'm looking around, all of you are professionals. You've been in, maybe not the same field that I am, but, a field, and I'm sure you've come up against it again and again like a brick wall. It's relationship management. And if you can get that right, you can, you usually navigate through fairly stormy waters.
So disregard the April 19th.
Yeah,
okay.
That's it.
I think that is, so this is developing.
And
So
actually,
this is last slide.
you can just ignore that. So basically, just the way things ended up, you worked on logic models a little bit this morning. So this is, obviously I'm using Carolyn's toolbook, and that's how theirs ended up is, okay, now go work on your logic model. So again, you kind of did that work. I'm not going to repeat it. All right. You guys should all have the paper evaluations in front of you if you want to do those. I really appreciate your time. This was a long, hard day. But we're up. We're if it makes you feel better, we're back on schedule
You
for
guys
the rest of
always
the
work this
curriculum.
hard. This is like, this is pretty
Yeah,
amazing. Pretty spectacular
It's
effort
a
that you guys are
good
putting in
group.
here.
It's a really
That's
good
awesome. Yeah. Well, it was a privilege to participate with you for
Thank you,
a
Omar.
short time. So
Thank you
very
very
much.
much.
Yeah, thank you.
Thank you for
This is
very
really
much.
planning, so we don't have to do that,
I
right?
think my how that is, and those are all presented at the staff there. You were literally honored.
Where the one where Nick Petrelli yelled out while I was about to get my award.
Well, he's yelling at Mike, not you.
Yeah, in all fairness, he was yelling at me.
Which one is this one today?
Number
This
5.
is number 5.
So do you go down and count 5 on the right with the
No,
bubbles?
It's the 4th bullet down.
Yeah,
after
it's
choose
section
session.
4.
Oh, okay.
Go by the
Research
dates
framework.
versus the title of the
I know, but
class. I created the survey very early on.
Oh, well, which one was?
It's the
yeah,
fourth
it's the
bubble down.
lining. It's the
So
4th
what
bubble
is
down
the
in the
right
session list.
Yes.
Okay. I see a cross-eyed here.
Oh,
Oh, I see, there's only 9 bubbles, that's cute.
Well, no, the first bubble's up under question. Remember, question 1 is the.
Oh, that's I see, that's why they're numbered different.
I know. It took me a while to figure it out.
Oh, I've been cold all day. It's freezing.
It was an observation.
I think it's warm.
They're gonna get it for it now. This is electronics, so that's
Okay, yeah, but sometimes I would put more info.
You're a community. You're a community investigator. I gave it to you.
So,
Better
both
use
they
it.
kept it up, and eventually they shut up. But not before she had the opportunity to lecture them. It was terrible that the CEO was speaking, so the CEO was speaking, so couldn't have the courtesy to call 5 seconds.
No.
I will be like rude and bad about him, so but most of it is there. Go back to the
Well, I mean, I wouldn't maybe it's the outsider. I think it's interesting sometimes. I remember
for this one, it's
you know,
just to
there's
read
a-
all of them, the highest, second, third, and then that one.
Yeah, exactly.
This re-aim is just a tool, right?
Yeah, it's a whole
Yeah,
round.
exactly. Yeah, because the guy had told that like,
Did Brian read this one?
Yes, he did.
thank you for actually putting that.
Okay.
Are these patients down here downstairs today?
No, I was doing social qualification when.
Okay.
Oh, okay.
Okay.
Thank you. See you later. Take care.
Oh, Mark, disregard that DV speaker request, Julie Silverstein's gonna do it.
Oh, fine. Okay. All I did was ask Kathy if she had any other suggestions. Like, I can't think of anyone off the top of my head.
Yeah.
But Julie
Did you
can do it.
both?
That's
She's gonna
great.
get
Chance to complete this pre-survey?
I got no agenda items for the research steer part of tomorrow.
All right.
Sounds like Willy Wonka.
Takes a lot of room to create.
Still want to do exactly.
What am I doing?
Having one like shorter than the other, most of my life hasn't helped my
What
life.
am I got to
No, I
do?
can't imagine.
They're all different, because one of them.
Long day for you.
Oh, that's why. So, same thing, so we'll read them all, and one, like, top three, versus.
Till 9 p.m.?
Oh, okay, I get
Same
the
thing.
top three,
Mhm.
cause I get.
Good man.
Yeah, so you read all of them, and then time requirements.
Well, fix my girl.
Last
Right,
name,
right,
or some of these may
okay.
not even be.
So this
current.
was wrong.
She's sweet.
Yeah,
She
so
was-
then,
I only met her
yeah,
once.
so just go off, and then scratch off the several ones.
Yeah, she said.
Got
So
it.
you even have, like, out of the four highest
She will
priorities,
become.
you can do highest.
Yeah, I did.
Break it down like
Yeah,
that.
yeah, I think I.
Because I only need one answer for each one.
Yeah, I think I've done
Okay,
that.
we'll see if they're all emails still
Oh, no,
work.
I mean,
Sorry,
for each
yeah.
column, one answer. So out of all of these, which one is
Ready for the
highest
cold, huh?
priority?
Yeah.
So you said lack of knowledge, blah, 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 is a high priority for you. Is that the
Thanks for looking,
highest out of all
that
of
was
them?
really, really good. Yeah, really, really appreciate it.
Oh, down the line.
Oh, come
Yeah,
on.
not,
I know, I
because
know.
it says select the top three.
Yeah,
It's easier to
I
do it on
really,
the website.
I'll
That's why I didn't want to
probably
do
send you
it.
an next day.
Because it only lets you select.
And I do really
one
appreciate
option
it.
from each column.
I'm just noticing that like.
I think we have the
This
same
question might be a little bit early,
thing,
but
where
in
you
terms
have
of
to
like this,
choose
Okay.
this
the
person,
options, but I can
that's
grab it
who
from
I
you.
talked to.
Okay.
Whenever.
So this
Like the
was.
actual ones for like, could like, I'm gonna use it
So
for
I don't- we don't have